Megan Fox has the story.
Megan Fox.
Megan Fox.
Megan Fox.
Megan Fox. Megan Fox, a national journalist.
Mastodon. I will never be able to say that out loud.
It feels like the Flintstones live there.
It does.
Well, don't trust women. I think you just touched on that with your last. That's what they brought. We're going to have to bring back chaperones.
Jesus, no.
Just careful. Stop! Break! Ooh. Hard right.
How did you screw up a stove, Megan? You're a woman. I thought that was baked into you. Like at the genetic level, how to operate kitchen equipment.
And honestly, Megan, if you don't like it, I'm sorry. I've been very nice to you.
You get Dino hanging out outside chewing on a large bone. I highly recommend being targeted by the New York Times and Rolling Stone for weight loss. And I'd say, keep it coming. I need to lose 20 more. Please, keep it coming.
Explain to me, Megan, why did this country not have a holiday once a year? That's the time you vote. If you don't show up and vote, up your ass. You don't get another chance. You don't get, I don't care if you're in the hospital. Crawl to the stake, crawl there. But that's it. 1 day, 12 hours, and then you're done. And you count them that day, and that night you know who the hell won.
I will eat you alive. You want to tangle? You want to go?
The only thing going through my head is, what are you going to do when Megan Fox runs wild on you, brother?
He made a deal with the devil. She's the devil.
He wants that.
Oh, God. Gross! Oh! All right. Penalty box for Slug. Yep.
A mile.
Are you ready to behave yourself now, Slug?
This frustrating rep.
Are you ready to behave yourself? Repossessed puppies. I'm hiding pork chop. Have you seen his little pork chop? Oh my God, pork chop is the cutest.
That sounds bad.
Have you seen it?
Pork is pork.
Though you may be tempted, do not contact any person or persons mentioned on this stream. Do not even think about contacting anyone who may be the topic of the daily news. If you should do that, the host will question your IQ, possibly call you names, and mock you for disobeying these basic rules of decency.
All the best.
What's up, everybody? Welcome back to the program. It's me, Megan Fox. I'm here with the panel, Mo in the Deep End, House of Fluxx, and Jennifer Williams with You Are the Power. We are covering the Hernandez case out of Georgia. It is a terrible case, a terrible story of medical kidnapping, and innocent parents charged with horrific acts of child abuse, which they were acquitted of, and we have the court footage. Now, the doctors involved in this, if you recall from the Timms case, these are some of the same doctors that did the same misdiagnosis of Carrie Timms's baby that also did the same misdiagnosis of the Hernandez baby. So we're still on the state's case. We are on their last witness, which is Dr. Wilcox. He is a geneticist. And what we've learned about Dr. Wilcox so far, ladies, is that everything that is abnormal in little Emma Hernandez is normal.
Yes. And he may or may not have sister wives or be Glenn Close in drag.
Right. We're not sure. We're not sure. Where has Nick been? Well, he's invited whenever he wants to come. But, Nick also has a day job. He works. So he cannot always be here. He comes when he can. And that sounded dirty and phrasing. Darn it. Where's my button?
Both Fluxx and I were looking at each other like it's Monday. We're trying to be good.
Like we just started. We need to catch it a little bit.
Yeah, we were like, are you going to say it or am I going to say it?
Nick appears here when he can. Let's try that way. How about that? I just didn't realize I did not post this on Locals, which I'm going to go do right now. And I do need to put the bingo link up for you in the chat. I did put the Super Tips link up, and then I realized, I'm not using OBS, so I can't even play Super Tips because I set up my camera wrong. And in order to reset it up, I think I have to leave the studio, which is annoying. So yeah, I guess technology. If you guys do send Super Tips, I'll have to do that. But if you don't, then I don't have to do it. We'll see. I have to put this on Locals so that people can see it. Yes. Notify. Pin to newsfeed. Yes. Okay. There you go. All right, folks. Thanks for hanging in there while I was away, and I was at a wedding for my niece. My niece is safely married and on her honeymoon, and it was a beautiful wedding in Maryland. We got a lovely weekend for it. The weather was incredible. It was very breezy.
Gorgeous.
It was perfect. Blue skies, no rain, no nonsense, and it was lovely. So we weren't sweating to death. It was nice. In fact, there was a cool breeze. And we went to have crab like 3 or 4 times. I think I had a ton of seafood while we were there.
These people and their blue crab. I'm telling you, no place I have ever been to has any place loved a food like Maryland loves their blue crab.
I know. And I didn't even have blue crab. Well, I did have crab cakes. They were very good. There was no filler in them at all.
I don't like picking.
Yeah, when they like they do the whole thing where you have the hammer and it's too messy. Nobody wants this. Nobody when they come to the table and they're like, "Is anybody having crabs?" I'm like, "No."
To be fair, when you're handed a hammer, and you're like, "Okay, that would be fun," but yeah, the whole
I'm like,
it's too much work to get into food that is that expensive. If you're going to charge me that much for something, it better come already peeled and cracked and whatever you need to do.
Right? Mm-hmm. Yeah. Right? Like you prepare all of it, not just halfway.
Yeah. Mm-hmm. Yeah. Like what's with the cooking and dumping on the table? Like
you wear the bib. You get into it.
You wear the bib. Yeah. How much does it cost to have my waiter wear the bib and crack open all the stuff for me?
I always make Mrs. Fluxx do my crabs for me. I'm always like, you do it. And she's like, okay.
All right.
But I always make her do it for me. Apparently, I'm not a real Marylander, but I knew this.
You're also not a real lesbian because apparently you don't work with tools.
Yeah, I don't work with power tools that often. I don't know the agenda very well. I don't know all the words.
Just in case we tell any gay jokes today, we're going to need this special gay blessing.
Ooh.
We're going to need
All right. Let's get the everyone and every person come hither and see. Don't flag this channel because fuck you and bless me. And the gay protection is there.
Oh, excellent. Jesse Jackson himself could not have come up with a rhyming poem like that.
Johnny Cochran is impressed.
I'm trying to get into the bard. I'm really trying to get the bard vibes going for when we get going.
Yes. Yeah, we do have to pick a date for that. We have to pick a date. All right. I guess I need to pull up the thing. Jennifer, is there anything we need to know specifically about Wilcox's testimony or anything about where we're at in the trial so far that you want to bring up that's important?
It's not really very important, but since I wasn't in there, Jonathan told me that we're going to see like an attitude change from this witness between Catherine and then when Steve starts. Apparently he doesn't like Steve. So I'm to Steve. Who doesn't like Steve?
Who doesn't like Steve?
Everyone should like
Steve.
Steve.
That's a weird nemesis.
So he said he remembers like the switch. So I'm excited just to see the difference between the two attorneys.
And we are almost there. Okay, so I'm glad you brought that up. That is a very cool thing that you just brought up. I'm so glad I asked. because definitely we want to pay attention and look for that. I also want to bring up, I forgot to pin the bingo link. I know the chat's yelling at me. Hold on. Hernandez trial bingo. There it is. All right. There is your bingo link. I am dropping it in the chat. By the way, hey, Rumble, what's up? I will come drop it over there as well. Bingo link right here, and I will pin it to the top of the YouTube chat, and then I will go over to Rumble and I will do the same over there. What the heck, YouTube? All right, there. All right, get your bingo cards ready. So no actual lawyers on this show. Hey, listen, nobody asked for your input. By the way, if you continue to harass me like this on my stream, I will be sending you a cease and desist. Maybe a second one, a third one, maybe 4.
Yeah, that's a lot of defamation right there.
A lot of it. We
will get Lisa Lee on it. We will.
You know, Lisa sent me a third and final cease and desist.
Oh, is it like 3 strikes you're out, or is it like buy 2 get 1 free?
Like you're going to repo your First Amendment?
She said that I have to preserve all my assets too. I can't. We've decided that means I can't really drive my car because that depreciates the value.
Yeah. Yeah.
I would start freezing pennies in ice cubes and send her pictures.
A third cease and desist. A third and final, by the way. Third and final. I've missed 2 deadlines already. This will be the third one.
I'm always like, after the first cease and desist, it's like, we told you to stop talking. Now we're really asking you, please stop talking. The third time, it's like, hey, we asked you twice. Now really, please stop talking.
Yeah. They're really funny. I'm actually going to go over them in detail tonight on the show at 8 p.m. Should be a good time. We will look at the cease and desist that I have received so far, and we will discuss whether or not I need to abide by any of the ridiculous demands in them. Spoiler, I don't. But okay.
But would any of them be fun if you actually did? Are there any fun ones in there?
No, because they're so unspecific. I can't figure out what in the heck she wants me to do.
Damn it.
You're supposed to do.
I mean, it's just crazy.
Oh,
so,
Lord.
Leg Warmer Lady, thanks for the $5 super sticker. I appreciate that. You are awesome. And Frankie gifted 5 Megan Fox memberships. Welcome to the Fox Den, all 5 of you. Thanks for that. I appreciate that. Starting the show off right. I guess I should open super tips just in case. And then if, of course, someone's going to send one just so I have to go out of the stream and redo my camera.
Mm-hmm.
You know that on the day that okay, let's see. Have any of you done that? I might as well get it over with right off the bat. No, nothing to see here. So that's great. I don't have to do shit. All right, great. Great. All right, folks. I am going to deny you of your 15 minutes of obligatory bullshit. We are only at 13 minutes, and we are headed straight into the testimony of Dr. William Wilcox. Bill Wilcox. Yep, that's his name.
Are we on cross yet, or are we still going to sleep?
We are so close to cross. Okay, look, Catherine shows up right there. Like we have 4 minutes to go or something. So you can do it.
Which is what this paper was about. That's why there are no norms for the young kids. Nobody's done a lot of them. So that's why we don't do the test. Even in kids with osteogenesis imperfecta that we're treating, we don't do it at such a young age.
So even though there is no standard based on this paper that took a small number of cases of children that had DEXA scan, was Emma still within the normal range?
Yes, as far as you could tell from that information. It's basically a test that shouldn't have been ordered.
And do you know who ordered it?
I don't remember.
Okay.
Jay, we know.
Ordered by CHOA.
I don't think so.
Okay. And so
I can't get over the fact that it does look like he is wearing one of those beards you glue on. I cannot get over it. It's so, ever since I saw, and I still can't find that video of the guy putting on all the fake beards that they use for the CIA or whatever when they're doing their, but I've seen this video over and over again with this guy who just keeps putting beards on, and they keep getting different lengths and different wigs to look, and that's what this guy looks like.
It's
See,
combo of the hair and the beard. It's the hair. The hair is just not. No,
it's so weird.
No.
I need to, like, shoulders are really narrow, and remember he has little hands, so he's just
right. Like a woman, like it's a woman playing dress up. It's very odd.
Maybe it is. Maybe
it's very odd. Yeah, he's like a master of disguise. This guy, like, who's under there? I need to know. This is like a classic. This is like a classic disguise. You got glasses, maybe a beard, and this weird hair.
I was gonna say maybe it's two children in a coat, and that's why the features are so small.
Maybe,
and that's why the beard looks fake.
Good call, Fluxx.
After seeing Emma in person, after going through all of her genetic testings, did Emma have any genetic disorders that would affect her bones?
No.
In your expert opinion, what was the cause of the fractures found on Emma?
Non-accidental trauma, otherwise child abuse.
I don't think I can roll my eyes hard enough right there.
I know.
Go back. Was Emma tested for osteogenesis imperfecta?
Yes, several times.
Okay. And what was the result of that?
Always nothing found.
It was not several times.
Nothing further.
How many times was it?
Choa sent off the one time, which is only 3 genes. Now, she had her parents did genetic testing, and it was like a broad panel, but he hated that she got that done. He said she was tested so many times he refused to do any more testing at this appointment because she had already been overly tested more than any child should. Is that not crazy talk?
So the child is tested and we can't figure out what's wrong. We're just not going to keep trying. We're just going to, well, we've done too many tests. Good luck, kid.
Wait, the first time in the history of ever, the doctor wants to be fiscally responsible and not order unnecessary tests?
Yeah, right.
And this
the
is
first time ever in the history of insurance.
This is after how many x-rays they've done on her?
Yeah.
Exactly. Not to mention
genesis imperfecta on here. I don't remember if it's still on here. I'm gonna look because if it is, I'm calling it. No.
Oh yeah.
I think I took it off. Dang it.
We should have known to leave it on.
I should have known. Yeah, that's my fault. Are these problem glasses?
They're women's glasses.
Not really. They are women's glasses, which makes
they are women's glasses. They're problem.
They're not. They're just a hair under where they cross over into the Katie Lang, Rachel Maddow line.
Right.
And he's got
they're like your lesbian aunt who has a Subaru and Birkenstocks.
I was gonna say you can't really tell, but my glasses have that same exact design except darker because I'm not.
All right, I'm gonna give it to the chat because these are women's glasses, which makes them a problem for him. Yes. I think he is shop, but see, he's a very petite man. He might have to shop in the women's section. His face might be narrow like his shoulders.
He should have stopped in the junior high section. I've seen bigger muscles on Chandler Holderson.
How about bad hair, says the chat. All right, I'll allow it.
Yeah.
I'll allow it. That is
he
not
didn't
good
scrunch
hair.
the crunch. He's not a really good curly girl.
He did not
guy.
scrunch out the crunch. See, now I just scrunched out the crunch. I washed my hair this morning, so I had that gel cast. You gotta do this and get rid of it. Otherwise, it looks like it's wet all day.
It looks like ramen all day.
Yeah, you don't want
ramen
that.
noodles.
He needs to give it a fluff and a shake and a scrunch. Yeah, but
A squunch, if you will.
A squunch. Squunch out the crunch.
That's going to be a new Choa initiative.
Squunch the
darn
crunch.
It, Jay. Now I have to go and change my the setting to being a paid promotion because look at what you're doing to me here. So now I've got to go into YouTube. I got to go, is this paid? and it'd say, yes, this is an endorsement. Okay, fine. Now I've fixed it. Just J Hip, thanks for the 5. Try Keto Brains, proud sponsors of Just J Hip. Don't be like me. Try Keto Brains to be smarter like Megan Fox. He's so not smart that he thinks Keto Brains is his sponsor. Keto Brains is actually my sponsor, but I appreciate that you're doing my job for me. I actually have a dose of my Keto Brains in my coffee today. Second dose of the day helps me stay awake and not sleep through half of the day like I have been doing when I turned 50. But Keto Brains is great. If you're wondering what the heck Keto Brains is, you go to ketobrains.com and you can read all about it. But it's nootropics, mushrooms, all sorts of good stuff you put in your coffee as a creamer or any drink, really, that you could put a creamer in, including smoothies, whatever. It's full of nootropics and good things for your brain, helps with brain fog, memory, all kinds of stuff. And I've been enjoying it very much. In fact, I got an email from somebody who told me that they started taking it and they've been trying to quit smoking, and that they had way less cravings for cigarettes after starting to take it. And I asked Molly about it, who owns the company, and she was like, oh yeah, happens all the time. Happens all the time. People are quitting smoking by drinking the Keto Brains every day. So try it.
I forget to take it like every other day. I gotta stay on top of it, man.
Well, I keep it in a little container next to my coffee so that when I get my coffee in the morning, I just put a scoop.
Oh, that's smart.
Move on. You just get a little container, set it on the counter next to your coffee. You won't forget. But yeah, if only these doctors had used Keto Brains, we wouldn't be where we are today. I agree with that, Angelfish. I agree with that 100%. These doctors need some Keto Brains. And if you use my code, by the way, let me put the banner up, because there is a new giveaway. I'm going to go over the details of it tonight on the show. I can't tell you off the top of my head what the new giveaway is. I know that it involves the sugar substitute, which is called Dulsa, which is totally natural, made from monk fruit, and it has this delicious vanilla in it. It is so good, and I hate fake sugar. I hate it because it always has like an aftertaste. Like even stevia, I'm not a fan of, but this one is really good, and I have not had that gross aftertaste with it. So that comes in the new giveaway when you use my what is it? A promo code MUG15 for a 15% discount. MUGSUB if you're subscribing to Save. That enters you immediately into the raffle for June. What month is this? Yeah, June. At the end of June, we will be picking 2 winners to get a new pack of all Keto Brain stuff, giveaway basket. It's going to be great. I'll go over it tonight because tonight, Molly from the company who owns the company will be on with me tonight. And she will be answering all your questions about Keto Brains because I know a lot of you have those. So Molly's going to be coming on to talk about it. Maybe we'll do a call-in show tonight. It'll be fun. You guys can ask her your questions. All right, back to Dr. Cox here, or whatever his name is.
All right, thank you. Just been on.
Thank you, Your Honor. All right, good morning, Dr. Wilcox.
Good morning.
Here comes Catherine. We are now on Cross. Cross is commencing.
Do you have any pediatric specialty?
I train in pediatrics, but I don't recertify in pediatrics. I don't do that. I'm a geneticist, and we treat all ages.
But you're not like certified as a pediatric geneticist.
There is no such thing. We're geneticists.
Well, but there are geneticists.
Wow, hostile.
True.
Right?
Whoa, whoa,
Yes.
whoa.
He is hostile.
Hold on. I go to a pediatric geneticist. My daughter has one. In fact, they will not let her go to the adult geneticist. It's not you can't do that.
Obviously, that doctor is making it up, Megan, because this guy on the stand says that's fake.
No, I'm calling making
Seriously?
shit up. Making shit up. There is absolutely a thing as a pediatric geneticist. That's not true. We go to one who happens to practice at the Children's Hospital here.
Okay,
Come
but
on.
this is Georgia where logic isn't allowed, so maybe they are not allowed to use.
Wow.
Maybe Jonathan meant he gets hostile with Catherine and Steve.
Yeah, because he's already
clearly-
hostile.
Wow,
That
someone found his
was right out the
testosterone.
gate.
Wow.
Wow.
And you're not one of those.
I train in pediatrics. I don't practice pediatrics.
Okay. Well, so I guess how often do you see children in a situation like the one where you saw it?
More often than I'd like to.
I can certainly understand that. But in terms
Can you
of
answer the
how
question?
many patients you see who are in her circumstance, where they've already been removed from the custody of her parents, there's been a finding by another doctor, and the DFACS worker is in the room with y'all while you're doing the exam and report.
I've probably seen 100 of them over the last 30 years.
And how many of those have you been working specifically with Dr. Messner over at CHOA?
Well, she's certainly one of the attendings for the last decade, so, but I don't count these.
Yeah, isn't
Well,
Dr.
it's
Messner a
Stephen
man?
Messner, right?
Yes.
Hold on.
He just said she.
Uh-oh.
She's
Uh-oh.
certainly
Did
one
we
of the
just dead name Messner? It is the
So
Holy Month
is
of
that
June.
why he's so feminine and he's such a
Does
fairy?
does Messner go by she, her pronouns? And we just don't know.
That would explain a whole hell of a lot.
That
And
would
why-
explain
Can we send
so
a Midol
much.
officially?
That would explain why we haven't received a cease and desist yet for all the jokes about Messner. He's like, yeah, well, that's true.
Well,
That's all true.
He's like, yeah, if they keep making fun of this, they'll never catch on to the real thing. Also, the fact that the geneticist can't identify gender shouldn't terrify anyone.
Let's go. I'm going with for fuck's sake. For fuck's sake, you check it off the bingo card.
Goodness.
Well, she's certainly one of the attendings
Yeah,
for the
she's
last
certainly
decade,
one of the
so
attendings.
What does that
I-
mean?
Oh, look,
wait.
Look at the prosecutor. She's trying to get his eye to tell him it's a he. He.
Well,
Look at her.
and like-
Watch her. Watch her.
attendings for the last decade, so,
Look at
but
her.
I
She's
don't
like, no.
count these.
Well, it's Dr. Stephen Messner, right?
Yes.
Okay, and
I
so,
don't count how many I see with which doctor and how many I see with this particular complaint.
well.
But that was
and
the question.
You may, since we had the opportunity
That-
to speak at the expert witness hearing.
What?
That
I'm
was
just- I'm-
he's like, I don't count who I see with. Yeah, but that's the question. The question is, how many times have you worked with Stephen Messner? Like, you have to answer that.
And not only that, he has no idea who Stephen Metzner even is, because I play that trick all the time. Somebody will say something to me and I have no idea what you're talking about, but I don't want to I'm like, shit, I'm supposed to know this. And you just give this totally generic answer that just plays off.
Yeah.
He has no idea who he's talking about.
He called him a she, so no, he has no idea who she's talking about. None.
Yeah.
A couple of weeks ago, I was going to ask how many times you see children that have been referred over after a finding by Dr. Messner.
Usually I don't get referred cases from her unless she's suspecting him.
Look at the prosecutor. She just put her hands on her face. She's doing this. She's doing the Kevin face from Home Alone.
She literally just said he's a dude.
I know.
Catherine just told him.
Stephen Messner.
Look at this.
To be fair,
Usually
I mean,
I
we're all
don't-
confused about what he is too.
True. Watch Yee. Watch Prosecutor Yee.
Referred cases from her unless she's suspecting, him, unless he is suspecting.
Oh,
a,
she's looking at the LinkedIn profile.
And then he just goes, I mean
For
him.
example,
I mean him. Unless he. Oh my Lord.
the fractures just didn't make sense. They were more typical kind of long bone fractures.
Did he
or
answer
we
the
got a
question
positive
yet?
Genetic test that needs
No. No, he has not answered the question.
interpretation. So something suggesting brittle bone disease would come to me. We usually don't see them in the hospital unless it's very clear that they have osteogenesis imperfecta or something else they need to see genetics. So they get referred as an outpatient if there is a concern. Most
He's
of the time
admitting,
there's not,
Megan.
and we don't see it.
Hold on, let me get over
Sometimes
there.
we see it.
Yes.
He is admitting, really, I don't get referrals from the hospital because they just claim abuse so often. Like he's,
Oh my
if you think
God.
about it, he's admitting that. He's like, that's why he doesn't know who the cap is, because they don't refer their patients to him. The only reason this appointment was done is because of Talkie's secret swab, and Defects then
They hired him. So yeah, he wouldn't know who any of these people are because they never go out for genetics. They just
don't look for answers.
They just accuse abuse.
Wow, that really
They
just hit me.
allege
That's
abuse.
crazy.
Yeah.
Yep.
Holy.
Them because the parents have brought up a concern about a genetic disorder, and so they've asked to see genetics, and that's why they come in to see me.
Well, in this case, it was a referral from Dr. Messner.
I might need to
over
take
at
my
Showa,
hoodie off. I'm
right?
getting heated.
Because of these genetic tests, yes.
Okay, so we've got abnormal genetic testing results that produce a referral from Dr. Messner over to you.
You have genetic testing results that show variance. That's whether it's normal or abnormal is up to me to determine.
It's up to you, is it?
He's God?
He's God. We met God. Everyone
Didn't
pay
Fauci
attention.
share?
No, please.
Tell everyone about this stream. We have the face of God. You've seen it. It's this guy.
He decides what's normal and what's abnormal.
That
Can you imagine
explains
a guy with
current
hair like that?
timeline so well.
Can you imagine a guy who looks like this being the one to tell you what's abnormal?
I mean, it seems about right.
Yes, chat. Abnormal is normal has now been called. Please do check off abnormal.
Wow.
Is normal.
I can't believe he said that like that.
He is hostile as fuck.
All of these
Yeah,
people
he
have
is.
something called a God complex. I don't know if you've noticed this, but all of these child abuse pediatricians and all of them, doctors in general, have a God complex. They think that they are God because they play God, in a OR,
could
or
they
they
be
play
right
God
potentially
over.
once or twice? Could that be
way
a thing that they
Dude
could do?
looks like a lady. Sorry, I saw that in the chat.
Dude
Now I'm
looks
singing
like
it in
a
my brain.
lady.
Dude.
I mean, honestly, yes, that is correct, Rick. Fluxx already casted her lesbian protection over the stream. We are safe from channel strikes or complaints about any kind of harassment of the month of June. It's over. We've already cast the protection. And Mo is wearing a rainbow shirt, so we are safe.
Yep, Bucky's.
She's wearing her June
I love it.
shirt.
It has a beaver on the boob.
We're
I
good.
can't.
We're also, we
Same.
celebrate
There's so
Pride
many jokes
hard
there.
here. Ready? Everyone celebrate Pride. Woohoo! Yay, Pride. Okay. I think we're safe
wait.
now.
Yeah.
Wait. Wait, I didn't hear that. What was that? I think you turned your mic down too low.
Did I turn it off? No. Am I still here?
You're here.
Yeah, you're here.
Oh, okay.
I just didn't hear your button if you played one.
Oh no, I was gonna cast the avatar again, but I didn't hit it fast enough.
It didn't work. Ah, gotcha. Okay. All right. So this guy has now just told us and everyone in the room that he is God, and they have not hauled him out of there in a straitjacket yet. Unbelievable. Unbelievable cheek, this guy.
Genetic test, but my interpretation is not necessarily going to be the same.
Well, and I think if you ever put into Emma's medical record that the reason for the referral was abnormal genetic testing, that is something that you put into her medical record, correct?
That is something the scheduling person puts into the medical record. That's the referral diagnosis, abnormal genetic test. So that was her referral diagnosis.
Okay. But if it's in the record under Dr. William Wilcox.
There's no way to get rid of it for billing. There's just no way to get rid of that diagnosis that they were referred onto in our system. I either have to change it to something else or I have to leave it. There's no way to just delete it.
Okay.
It screams at me if I try to do that.
Well, and I think we've all learned a lot about the way that medical record systems work in this trial.
Or don't work.
But the medical record does show a referral from Dr. Messner for abnormal genetic testing, which then you placed your report under that heading.
Yes.
And you're saying that's just for billing purposes.
That was the referral reason. My diagnosis for the billing purposes was multiple fractures.
Okay. Well, and has there ever been a situation where Dr. Messner has made a finding of non-accidental trauma and referred the case over to you and you said, actually, we've got some abnormal genetic variants going on?
She's usually referred things.
She again.
Question.
Why does he?
A genetic diagnosis, and that's what.
He's gonna get a strike against him.
I wonder if. Do you think he's used to dealing with Verena Brown?
It's possible.
Probably.
And he gets the two of them mixed up.
I think Verena Brown of the two doctors would be more likely to ask for an outside opinion, whereas Messner would probably never refer out because he is a child doctorologist and he knows everything. Like they're just radiologists. He knows ology much better.
Oh God, it's
I
just so
he knows
funny.
all the ologies.
Gosh,
he just keeps saying she.
Or that one has been made, and then we're doing the evaluation, counseling, and treatment if it's needed.
Is he even talking about the same
additional genetic?
Is he what?
Is he even talking about the same kid? He keeps talking about a female doctor. Is he even confused? Is he even talking about the right?
Is he on the right case?
Well, that is my worry because he hasn't said anything unique to Emma yet.
True. Not only that is I really don't think he knows who Metzner is or Metzger is. I don't think he knows any of these people. I mean, he knows them because they tell him when to claim abuse, but other than that, he doesn't know what's on the hole in the wall.
He did not do his homework before this trial. I'll say that. He did not do his homework.
Well, also, it strikes me as odd that a children's hospital is going to have a, geneticist who specializes in pediatric bone disorders, and he isn't in regular contact with kids with multiple fractures. I mean, how many patients does he see? If Georgia knew that they had a bunch of problems with bone fractures and things like that, then why aren't we looking at the problem? It seems like they were aware that there are bone problems down there.
They don't want to know. They'd rather just accuse the parents of abuse and give the prosecutors something to do and increase their conviction rates, I guess.
Well, he said he's only seen about 100 of these cases in 30 years. So they do not go to him very often in that case.
Right. No, they don't.
He's just sticking with the narrative. He's just going, okay, this is what Choa said. I work for Choa. I'm going to keep it. That's the narrative.
He can't even keep it straight. Who
Well, and
Messner
Green
is.
Piper is saying she's a coder, and the reason for the visit has nothing to do with the final diagnosis that's documented in the medical record. So, yeah, they wouldn't be billing off of the code for the reason for the referral.
Yeah, this is crazy.
Testing on Emma Hernandez.
No, she'd already had plenty, and she had even more after the one that I hadn't seen.
So you are just reviewing the testing results that have been already done and sent off to these various laboratories, right?
Yes.
And you kind of feel like there wasn't even any point in doing all of that genetic testing. Is that right?
Based on the x-rays and the injuries that were there and the lack of fractures in a protected environment. So you had a bunch of fractures, and then to get removed from that environment and they don't have broken bones anymore.
He's saying the genetics don't matter.
Oh my God.
He's
Yeah,
legit
he is
about to
saying that.
say that the genetics don't matter because the broken bones.
He's
and the
going
kid
with
was
the narrative. She was removed, but he should know better than anyone that physical therapy, the right kind of diet, if there's
Vitamin
fractures,
D.
he should know that. And he's acting like, oh, she was removed, no more fractures, everything's fine.
So that somehow explains the genetic abnormalities.
Yeah, and even as
does
infants
that.
get more control, their moving of their muscles
Yes.
is going to strengthen those bones, just from
Absolutely, 100%. That's true.
just from growing. Yeah.
Oh my gosh, this man is really irritating.
Factors that they have is typical for non-accidental trauma, and there's nothing on the x-rays or the CT scan, anything to suggest a genetic disorder. Then
Why
usually,
look?
if I saw them in the hospital, I'd say, don't do any genetic testing, it's not indicated. They usually do it for defense purposes. So they know they're gonna get called to court, so they will order this collagen diagnostic laboratory testing of these 3 genes that produce milder OI, osteogenesis imperfecta.
See, the 3 genes, he admitted to it. He admitted to it. They usually do the 3 genes associated with it for the defense, just to come to court to say, there's nothing wrong with this kid.
Well, and he's going based on the worst case scenario, the almost often fatal osteogenesis or osteogenesis imperfecta, where the children die, unfortunately, in the womb. There's a whole sliding scale.
Yeah.
For a medical community that wants to put everything on the daggone spectrum, they're really, really staying with this. Either you have the fatal kind or it doesn't exist.
Or it doesn't exist. Yeah, you can't have
genetic
any
testing
form.
is not invasive at all. It's a cheek swab. Why
Yeah.
not do it? He's like, oh, well, there's nothing saying we just shouldn't do it. But it's a cheek swab. It's not invasive at all.
Meanwhile, they put her through how many x-rays?
Yes. And a feeding
for a
tube that they
feeding tube?
apparently didn't need.
God, that pisses me off.
Sometimes if there's a few fractures, it can be confused with child abuse, so that's why they do it. But you don't send these big, giant tests sequencing all of your genes for these patients because that's
Why
not
not?
indicated.
So then is it safe to say that, yes, you felt like there was really no point in needing to go through this clinical evaluation at all?
Well, I did. I mean, she was referred to me with these things. I'm going to go over them. And I wanted to make sure she wasn't at risk for having one of these muscular EDS things. I wanted to evaluate her for that.
EDS
She has
things.
these variants. And is there anything else in here that I need to worry about? So I do my job and I get tests. I'm going to look them over.
I do
I'm not
my
just
job, get
blowing
paid,
it
and
off
that's
and
it.
saying, oh yeah, I looked at the x-rays and that's clearly abuse and I'm done.
Okay. So you did want to conduct further evaluation.
I looked at everything I had, which was a lot.
And so you've been qualified as an expert in skeletal disorders. How about connective tissue disorders generally?
I see a lot of those too.
Okay.
Are you an
And
expert?
I guess, how would you describe how connective tissue disorders and skeletal disorders are related or unrelated?
Oh, they're usually put in different categories. And there's some that overlap between the two. You can have a combination of osteogenesis imperfecta and Ehlers-Danlos caused by mutations in the osteogenesis imperfecta genes. And it's pretty common for kids with brittle bone disease to have loose joints. That's not unusual because the collagen that's a problem in the bones and in the teeth is also in the ligaments and tendons. So they're going to be a little loose jointed. That's common.
Okay. Well, and so you mentioned problems in the teeth. So let me move back to the history that you received on Emma.
Yes.
And so that was, she presented on June 6th with fractures, was taken out of the custody of her parents, and then never had any more fractures or issues.
I don't know what issues she had. She had no more fractures, is what I was told.
Were you told anything about any bruising or unusual markings?
There are certainly records at Children's on this, including pictures that were taken. And, I put those in my report because it's part of the overall history. It didn't really factor into my decision about what was going on with the bones, but it certainly would be relevant for these proceedings.
Okay. Well, so there's nothing about unusual markings or bleedings or bruisings that would be relevant to assessing how collagen production has manifested in Emma Hernandez?
She doesn't have any mutations in collagens. So people that have connective tissue diseases sometimes bruise easily.
It's collagen
That can happen.
12A1.
But it's, not the normal handling of a baby. It's like, I'm bumping into something, running around, and I bruise more easily because my connective tissues are a little weak. So that can happen.
Okay. Well, and so I guess connective tissue and bone strength, do they exist on a spectrum, or is it like binary?
No, it's a spectrum.
Okay, so that is fair to say.
I don't like his characterization that a connective tissue disorder is just that your connective tissue is a little weak. I don't like, he's really downplaying what EDS is and what it causes. Imagine, folks, your entire body, all your organs, all your muscles are held together by one thing, connective tissue. If you have a connective tissue disorder, your muscles don't have stabilization. Your organs don't have stabilization. And the unexplained chronic pain that comes with that is indescribable. So the idea that your tissue's just a little weak.
Yeah.
That's literally not what it is.
No, it's so condescending. And if he's really a specialist, then he should know the hell these kids live through. Even if he wholeheartedly believes that Taki and, gosh, is it Matt?
Matt.
Taki and Matt were completely guilty. He should explain how horrible this life is. Because, these should be the kids that he has to listen to every day cry because they're in pain or because they can't do sports.
I bet that he's a real treat in the exam room when you've got a child trying to explain this to him. Oh, your connective tissue is just a little weak.
Yeah.
You're just tired. You just do some workout.
Just work out more. That's what they, I don't even, I'm so not in a place where I can discuss this without rage. So I'm just going to keep playing this because I'm going to rage out.
For different, genetic disorders of connective tissue or of bone, they exist on a spectrum. Genetic disorders.
Okay. And Emma does have multiple mutations on the Col 12A1.
She has 2 variants. Let's be careful about what's a mutation and what's a variant.
Well, and if you could clarify that the difference between a variant and a mutation.
So a mutation that is you're classifying a variant as
Sir, you are a mutation.
Is it benign, means nothing? Is it a variant that's unknown significance? Or is it pathogenic or likely pathogenic, where it may cause disease under certain circumstances? So you're sorting through those things. And if you're calling it pathogenic, you usually refer to it as a mutation, but you could refer to it as a pathogenic variant.
Gotcha. Okay, so mutation and variant are not synonymous. Mutation implies that it's pathogenic.
It's usually in common usage, you wouldn't refer to it as a mutation if it's just a benign variant.
Okay, gotcha. And is that standard among geneticists? I
don't know all geneticists, but that's pretty standard amongst molecular people.
Okay. So it would only be called a mutation if it's pathogenic.
That you shouldn't be using mutation as a term that you use for a benign variant.
Okay.
It just implies something that isn't really there. They're just, it's somebody from a different culture, somebody from a different family. It's not in the normal database, doesn't mean it causes anything.
Wait, is he saying that because she's part Thai, that look, it's just her Thai genes being all weird? Like, I don't know.
Just a weird Thai gene. It's just a normal variant.
Okay, so Emma has 2 genetic variants on her Col 12A1 gene.
Yes.
Okay. And are you familiar with the article from the Journal of Cell Biology by Izu, Sun, Zwolinek, White, Williams, Cha, Jepson, Koch, and Burke? Type 12 collagen regulates osteoblast polarity and communication during bone formation.
Yeah, there's some other papers that relate to this same subject, and I've read those as well. And these are in mice. These are mouse models where they have knocked out
Megan.
Col 12. So what happens
Ooh, I think Mo just got triggered.
Okay, how dare you? First of all, I don't agree with us using animal analogs for testing, but they are used across the medical field. So how dare he say this is mouse DNA? We use pig, models. We use all of this. We test on mice before we test on people. How dare he, try to gaslight, well, these are mice, and science doesn't work that way. They're used for
Then
a
why do we
reason.
test on mice?
Then why do we do it?
Apparently, we're
if it's
just assholes.
Did you see they recreated the woolly mammoth mouse?
What?
They made a woolly mammoth mouse.
Yeah, they
because
made
they
a
took the
super hairy
DNA from a
mouse.
woolly mammoth. Yeah. They're
That's a
messing
bad
with
idea.
DNA from
It's like they haven't seen all of the Jurassic Parks.
Mm-hmm.
Also,
But if you ask this guy, genetics don't matter.
No, they're just
I'm
guy
reading
things.
one of Emma's. I've got it in front of me, and it literally says a heterozygous, likely pathogenic variant. It says likely pathogenic on her collagen 12A1.
Holy cow.
For him to talk about that it's just a variant of unknown significance. She did have multiple testings, and the one done here, I'm sitting here reading it. Dr. Chris Sperry, who was one of the first doctors who testified in the very first adjudication hearing. This was done in January of 2024, and it says likely pathogenic. So how can you sit here and minimize it? So that just ticks me off. It makes me angry.
Minimizing problems. Don't we have that on the bingo card?
Yes.
Minimizing. I know that's on here somewhere. If you have something that says minimizing problems, go ahead and check it off. I don't see it at the moment, but I know it. I feel like it's on here. Should be anyway. I also have this. This is interesting. The court reporter sent me that was there. Said this moment happened after the cameras were turned off, by the way.
Ooh.
Oh my gosh.
Helen Mirren.
Oh my gosh.
It works too well. Oh my
Unfortunately, Jeb just wasn't in the room when it was finally revealed. He's like, if it weren't for those damn kids, I would have gotten away with it too.
That is so creepy.
AI is bad. AI is getting to a point where we shouldn't mess with it anymore.
I know.
This is how
Pretty funny,
Skynet gets us. Funny memes.
Funny memes.
Oh my
Skynet
gosh.
understands that the way to get to infiltrate is just to be good at memes.
Yes.
All right, that was a joke. It was a joke. He's not actually wearing
nightmares
a
from that
disguise,
joke.
as far as we know.
Humans, if you don't have any call 12, is you're contracted and lying there in bed, and you're not going to be probably walking around at all. But mice, they have some limitations in mobility, and they're walking around. So they're not exactly the same as people. Mice are not people. And
No
there's plenty of
shit.
Examples like that in science. Where
Okay.
I didn't know that.
We do agree on something.
Mice are
I'm
not
so glad
people?
he went to school for 17 years to figure that out.
I learned something new today.
I'm not going
I
to
did not
recover
know
from
that mice were not people.
I'm not going to recover from
Holy
that
shit.
easily. Mice are not people? How will I explain this to my children? Damn it.
I've been living my life so jacked up.
Wait a minute. You mean Mickey Mouse is not real?
He's not a person.
How dare you? How
I
dare you? Of mice are not men. JKT, good to see you. Mice are not people.
you do something in the mouse, it produces something, and it doesn't do the same thing in humans. It's not, or there's something in humans, and you put it in a mouse, and the mouse has nothing. There's variation because
How
we're
about we
not
just
the same
leave
as
the
mice.
mice alone?
Different
How about we
mice.
stop
grew a
putting
human
human
ear on him.
beings
Get
on mice?
hands off the mice.
Yeah. Just stop dealing with mice. How about we-
Although, would we rather them work on mice or dogs? Because, you know,
Definitely
if you go by
not.
Fauci
Definitely
standards,
leave the dogs alone too.
Okay, what
Yeah.
about people that are all the guilty? Like they filmed and they're all the guilty. They're humans.
you know,
Oh, you
And
mean
humans
like
are people.
people
I
on
see.
death
Humans
row?
are people. That's an idea, Mo.
it's also a
Hundreds of
fun
millions of
fact.
years
Humans are
from-
people.
Humans are people. Save the mice.
So those mice had weaker bones that under force could be broken more easily, under force. So not under normal conditions.
What the hell are they doing to the mice?
They're breaking
And this
mice's
hasn't
bones.
been observed
Apparently, they're breaking
Under
them.
force.
except for that severe muscular dystrophy contracture disorder, ULRIC. It has significant mutations on both copies of collagen 12, and they have narrow bones. So they break. That can happen with any neuromuscular disorder.
Okay, well, and thank you for the explanation. We obviously can't just take whatever's happening in mice is automatically going to happen in humans. But do you believe that type 12 collagen has a role to play in osteoblasts, are the cells that create bones, right?
Yes,
And then bone matrix formation is sort of the process by which the network of the various elements and collagen are sort of put together to build the bone, right?
yes.
Okay, so would variants in the COL12 gene produce any effect whatsoever in humans? Or do you feel like you can rule that out?
Prove it. That's what I would say. Prove it. What's the human conditions? So you've got the human conditions, you know about whether they break their bones or not. And in this particular case, one of these parents, I don't know which one, has this likely pathogenic, according to the AI life report, likely pathogenic in COL12. And yet they don't have anything. So how can you conclude that
What?
in Emma, she's going to have something?
What? Because
Well,
she has
maybe
unexplained
it
broken
causes
bones. Oh, I don't know. Maybe it's the unexplained broken bones when the parents say we did not do this.
And the markings and the GI issues and the teeth
and the low vitamin D and the birth trauma and come on. How
No, that's
is
all
it-
just abuse.
and one of the parents has it, so what are you, and they don't have anything. How do you know that they don't have anything? Did he do a full-on investigation into their medical past and their symptoms? Maybe they've never been diagnosed. Maybe that parent has had all kinds of problems that's gone unnoticed, unrecognized by their physicians.
Also, he works with children. He is so condescending. He is so he's not open. I mean, at least with Mercer, he's animated. You can tell that he at some point has a human emotion. This man has been nothing but snark and condescension. I can't imagine him speaking to children who do have osteogenesis imperfecta and are having to learn that their life isn't going to look like other kids. Well, prove it. You can do it. Take a salt pill, take a
God.
lap.
Awful, just awful. But I think it's funny that both of you have decided that Dr. Messner's name is now Mercer. You've just blocked him out completely. You've been calling him Mercer for all day,
He's
which
been
is
calling
fine.
him
Call him
she.
whatever you
I at
want.
least landed on the same letter.
The bones, maybe in their 50s, they're going to have something. That hasn't really been studied in people.
Well, maybe
As
you
to
should
whether
start
over time
studying
they're
it.
going to develop something over decades.
Right?
But it's irrelevant for a kid. That's not something that's been observed in the kids. So, especially
They haven't done
in-
testing of children.
JKD. Condescension from a man who has a effing ramen mullet.
It is.
He's got
it
a
is
lot
rich.
of balls. He's got big balls. I'll tell you that much. Just looking like that and then being like above it all is really something, sir.
So you
Ramen
don't
mullet.
believe cases like Emma's where there are unexplained fractures are
Nail
any sort of
pattern
evidence
ramen.
to be taken in the continued investigation and research into the impact of these genes on bone health and development?
Oh, I didn't say that. I said bone health and development is certainly a reasonable thing to investigate in people who are carriers for of a COL12 mutation who don't have the muscular disorder, just carry the recessive form. Do they ever have anything later? Maybe it contributes to osteoporosis in adults.
Oh my
But should do that study. Does it relate to children? No, it doesn't. And the other thing you have to consider is the fractures that you have at the ends of the bones. Those metaphyseal fractures, those aren't through bone. Those are through the cartilage. So that's the growth plate fracture. And when it gets pushed to one side or pulled, it's going to break because it's the weakest place.
Megan, can you pause? Because I'm
they call it a
confused.
fracture, but it's a fracture through.
Okay, so it's a break through the collagen growth plate that has nothing to do with the fact that she has a potentially bad mutation on a collagen building gene.
Irrelevant. It's irrelevant, Mo.
So it's not a bone fracture, it's a collagen fracture that has nothing to do with the collagen
With a
gene.
collagen disorder.
It
Why?
is too Monday for
So
this
much
shit.
easier for them to go straight for abuse instead of looking at the growth plates as this baby is
Yeah,
growing.
is this just laziness? Is what we're looking at
Yes.
just laziness by doctors who don't want to do their jobs?
Laziness and that heady feeling of being right. Knowing you can be questioned, but you have the answers.
But here's the other thing I think. If they had sent this baby to the actual specialist instead of trying to make their hypothesis correct, and the hypothesis, of course, being that the baby was abused. If they had sent this baby to doctors whose job is not to look for abuse, I feel like those doctors would have investigated, but they never gave them that chance. They never did that. They never sent her to specialists without the bias of this is abuse.
Yes. Well, every doctor that did look at Emma's stuff for the defense did say there's no abuse. I see nothing that says abuse. So it's literally a battle of the experts, you know? And it's so messed up that they're using a baby in a family unit in the middle, like a tug of war. It's so gross.
It is gross. I do not like these
I came in
people.
late. I'm going to need you to go ahead and start from the beginning and repeat all
Are you hearing that?
commentary verbatim,
Yes.
including chat. Thanks in advance.
All right, so we can't see it on the screen, but we can hear it. So
That's
that's cool. Let's see. That was
pretty neat.
from Sticky. I'm gonna need you to go ahead and start from the beginning and repeat all the commentary verbatim.
Oh gosh.
Yeah, that's gonna happen. That's gonna happen. Just rewind, Sticky.
The cartilage itself. Unfortunately, it heals itself and grows back together.
Is one of the differences between bone and cartilage that cartilage has more collagen in it?
Different collagen.
Okay, can you explain a little bit more about that?
So your bones have the biggest collagen that's there is collagen 1. And that's made up of products from 2 different genes.
Oh, Chad
The
hit
major
fitness. I'm calling it.
collagen in
Chad's
cartilage is
pissed.
type 2 collagen, whole different gene. And if you have mutations in type 2 collagen, you are either going to have premature arthritis, or you're going to have a dwarfism, or you're going to be born with some eye problems and a small lower jaw and a cleft. So there's a lot of different things that collagen 2 can do, but fractures aren't one of them. So they are more likely to break through their growth plates than anybody else.
Okay. So cartilage doesn't necessarily have more collagen in it, but it has different types of collagen in it.
Different collagens, different non-collagenous proteins. It's completely different structure, different purpose.
Okay, so the so you've had the opportunity to review the reports of some other geneticists who have looked at Emma Hernandez's records, right?
I reviewed Dr. Krishnamurthy's report, yes.
Okay. And I believe you were able to listen to the testimony of Dr. Gerard Pauls, correct?
Yes.
Okay. And you think both of those doctors are wrong, right?
I think Dr. Krishnamurthy is stretching something beyond credulity when she is going to claim things for these variants of unknown significance. I think you got to relate it back to what the kid has.
Okay. And
Dr. Pauls.
You don't know what the kid has.
Wait, Dr. Pauls is what?
He's a laboratorian.
Oh yeah, he's like the world's foremost researcher in these things. Like he has an entire institute.
His own
Megan,
lab.
he hasn't worked at, CHOA. So he's just a
He doesn't work at
laboratoriologist.
Dr. Pauls is a laboratorian. He worked in the laboratory. He's retired. He's not a physician. He has no business offering opinions on medical diagnoses.
so the fact that he runs the laboratory that genetically sequences the OI related genetics, not relevant to you.
He could maybe interpret these reports in the Netherlands where he has his life.
Oh, so now the Netherlands is a problem. Or we're racist against the Dutch. The Dutch are not as smart as the Americans, I guess.
I got to bring up Jerry here. Jerry says, I'm bringing Jerry in because, like, holy shit, what the fuck is this?
Yeah, and on that note, daggone, pale on pale violence. Like, apparently he is upset.
What a bitch has been called on the bingo card. What a bitch.
Yeah,
in case anyone on the chat is wondering what he's talking about hearing his testimony, remember before the trial started, there was a Dahlberg hearing. So all of the state's witnesses got to listen to the Dahlberg hearing. They were all online listening to the entire, everything that the defense team said. So that's what he's referring to.
Well, I will be back when we do this again. I have to, mom taxi duty calls.
All right. Well, we will miss you. Thank you for being here.
You are welcome. Bye.
See you, Mo. Chat hates witness has been called. I think that's the one you guys were missing. Chat hates witness. Why can't I find it on my bingo card? I know it's on here somewhere. Chat hates. There it is. Okay. So far, what's been called on bingo is problem glasses. Abnormal is normal. Chat hates witness. For fuck's sake, they're making shit up. What a bitch. Bad hair and lazy investigator.
You know, needs to go on the next bingo card is mice aren't people.
There's no way we'll get that twice in a row.
I didn't even think we'd get it one time in a row.
True.
Licensure, doing so in the United States is a little dicey because he's not board certified here.
Are people in
We have
America
training programs here, and you get
Apparently.
certified in this stuff.
Because he's not
And you
board
shouldn't be signing
certified.
out reports
Okay,
here.
sorry. The American Academy of Pediatrics, they're just so high and mighty and they have all the answers. And nobody in any other country can be smart because they're not American Board of Pediatrics certified. Well, let me tell you something. There are a whole lot of doctors around the world who knew that red dye was poisoning people before ours did.
Yep.
Now it's taken us 30 years to catch up with the fact that red dye is causing ADHD in children.
Yeah.
And the American Academy of Pediatrics, to my knowledge, still doesn't have that as a warning anywhere. So what does that tell you about the American Academy of Pediatrics? They're a bunch of assholes.
I would choose foreign doctors anytime.
Special kinds of assholes. Sorry, what did you say, Jennifer?
Foreign doctors. I mean, every good doctor I can think of that's helped a family member has been a foreign doctor. Like I'm sure there are great American doctors, but looking at someone who's in the Netherlands who runs his own lab and being like, oh, it's a little dicey if he's doing anything here. Why?
Yeah.
Because he's not pediatric board certified.
Certified.
Give me a
like
break.
Verena Brown.
He's got, if you look at Dr. Paul's resume, because I have, it is long. It is decorated. The idea that somehow, because he's not an American, he can't be an expert, or he's somehow less than Dr. Stephen Metzger, who got a 3-year certification in something. Give me a break. Give me a freaking break. I would put my life in the hands of a Dr. Paul's. I wouldn't trust any of these people to carry my groceries, let alone take care of my children.
Amen.
If you're not board certified.
Okay.
I don't know what the training is in the Netherlands.
I don't know what the training is in the Netherlands.
He is a
what a
he's
bitch.
acting like a woman.
What a
fucking
bitch.
This is female coded behavior, what he's doing.
Well, we know why that is.
Yeah. Yeah.
Creepy.
Like he is bitching out like a woman. I mean, I'm not trying to offend women because I am one, but he's fucking starting to crash out like a woman. Well, I don't know what kind of credentials they have. He's a fucking Karen.
Petty. That's petty. You shouldn't throw stones at the other witnesses. That's just
maybe you should find out what their credentialing is before you say something negative about it, because it might be better than yours.
Yeah, but it's not American, so like this is fucking Karen bitch behavior.
In the words of Shrilla the Killer, defer.
You think the United States has the best genetics and nowhere else in the world
I didn't say that.
to contribute?
I didn't say that. I said you can consider what they got to say, but what right do they have to offer an opinion on genetic tests in the United States?
What right do
They're
you?
based outside this country. They can offer opinion, but you have to consider it in the context of what their experience is and how much they
let's
know.
look at Dr. Paul's
let's
experience.
do it.
Let's do it. Let's bring it on. Let's bring it. Let's see what it is, because I've already looked at it. It's pretty impressive.
This is one of the dudes who's like, I'm in a club and you can't be with us.
Yeah, you can't you can't sit with us.
She belongs to a boating club. She 100% belongs to a boating club. I'm calling it.
All right. Gerard Pauls is a what? Security check? Why do I need a security check? To verify I'm human, for God's sake.
Ooh, the feds are watching you
Mice
now.
are not humans. Mice are not humans.
Make sure to tell them.
Where is his thing? He's a PhD. What is all this? This is not what I want. Hold on. He has a PhD. Hold on. I'm looking for his actual CV because I know it's on here. I've looked at it. Amsterdam. Oh, I could be running into the language issue because it's all in Dutch. Oh, darn it.
Oh, yeah.
Well, I'm sure we're going to hear.
Sprechen Sie Deutsch?
I'm sure we're going to hear his credentials when he takes the stand. Does he take the stand in this case? Jennifer, does Dr. Pauls testify?
Yeah, via Zoom. No,
Okay.
no. The state wouldn't allow it. The state would not allow it.
Oh, so they can impugn this man, though. Their witness can impugn him on the stand, and then he doesn't get to speak for himself.
Yeah, because he's not American.
Wow.
He wasn't in America.
Wow.
And what's their training?
So that's a yes to my question about you think these other doctors are wrong.
I think they're wrong in their conclusions, yes.
Okay. So let's just make sure that we are clear on which genetic variants Emma Hernandez has. She's got the call 12A1 C.2320 C greater than T.
2T, it's not greater than.
2T.
Yes.
Okay.
Yes.
So and she's got that genetic variant, correct?
Yes. So you're doing the cDNA, which is based on the messenger RNA sequence. It's not what the predicted amino acid change is going to be, which may be a little bit more relevant in the case of this particular mutation that you're citing.
Okay, so what would we need, what additional information would we need to attach to that variant in order to capture the information that you're referencing?
So that's what the PDOT is. That's the protein change, which if you translate this language here, it's
all right. Since we are not going to get to hear about Dr. Pauls, I'm going to tell you instead. I have finally found it. All right. Dr. Gerard Pauls is a Dutch clinical geneticist, molecular geneticist, and biochemist. He earned his MSc in biochemistry and a PhD in genetics. He spent most of his career at the Amsterdam University Medical Center in Amsterdam. In 1989, he established a diagnostic laboratory for DNA and protein testing of inherited diseases at VU University Hospital, which later grew into a large genetics program within Amsterdam UMC. After retirement, he remained affiliated with Amsterdam UMC in an advisory and research capacity and also became a professor of human genetics in Indonesia, teaching at universities Gadjah Mada and universities something else I can't pronounce. His work has focused heavily on osteogenesis imperfecta, heritable connective tissue disorders, Marfan syndrome, rare bone disease, molecular diagnostics, human genetics and genomics, inherited skeletal disorders. Amsterdam UMC identifies his major research fingerprints as bone development, Marfan syndrome, fibroblast biology, osteogenesis imperfecta, and related genetic disorders. He has written more than 300 scientific publications, approximately 20,000 plus citations, according to ResearchGate and Google Scholar profiles. Research has been widely cited in the fields of genetics, connective tissue disorders, and inherited bone diseases. He is a senior researcher and faculty member in human genetics at Amsterdam UMC, former head and founder of a major diagnostic genetics lab. We went over their professorships. He became known internationally for work involving differentiation of inherited bone disorders from suspected child abuse cases. He has published on the genetics of osteogenesis imperfecta in child abuse investigations and has stated that he has served as an expert witness in roughly 90 suspected child abuse cases. In 2022, he interviewed with the Osteogenesis Imperfecta Federation Europe. He discussed his role in evaluating cases where genetic bone disorders may be mistaken for abuse. So, that's a pretty big.
He doesn't like him.
That's impressive.
Mm-hmm. That's a pretty big background. And in other words, a premier world geneticist. Yes. So he's not just a guy from the Netherlands, but he practices all over the world, Indonesia, in all sorts of, and has been in 90 some cases. Like, come on.
What did he call him? What did this idiot call him earlier? Just a researcher? Is that what he said?
A laboratorian.
No, just a laboratorian or a laboratorian or
laboratorian.
Some stupid.
Yeah, he's just a lab geek. He's just a lab geek.
It's just so sad because Dr. Pauls helped Jameson be cleared, helped his parents. And he's such a kind soul. He doesn't charge families anything. He was recovering from a stroke when he testified for the Tims. So it's like idiots like this give these good doctors, they treat them so crappy. And they're such good-hearted people trying to say the truth. It's really gross. It's really...
JKD says laboratorian retriever.
Yes. I mean, technically, because he's retrieving the labs.
He does have Labrador energy. I would say Dr. Pauls does have that Labrador sort of energy about him. Trustworthy, always there for you.
Number 774. So this is a big, long sequence. 774 is pretty early in the sequence. And it's changing it to a stop codon. So that just ends that thing from being translated into protein too early.
Okay, is this where we get into the concept of nonsense-mediated decay?
You can, yes. It could undergo, when it occurs that early, that messenger RNA that contains such a premature stop codon may be destroyed early. So you make half the normal amount. The other allele, the other copy would be making protein, this one not.
Okay, and so nonsense-mediated decay is actually a good thing for our genes to be engaged in, right?
Often, yes. It's usually protective to get rid of these damaged RNAs. And so you're not making something that's abnormal and could be, if you have a complex, that this could be put into. So, or associated with other proteins, it could make that whole complex not work. So you put something that's too short and abnormal, if it's able to get in,
You're
and be
short and
incorporated
abnormal.
in that whole structure, it pumps out the whole structure. So getting rid of it before it has the chance to do that with this nonsense-mediated decay, meaning premature stop, the cell has a way of getting rid of those RNAs. That's protective for the human body.
Okay, and thank you, doctor. Let me make sure that I'm understanding this correctly, and we greatly appreciate the jury's patience with this highly technical and expert witness. I think we can all learn a lot here. So in a normal person with no genetic.
I have a feeling that big lead up was Catherine's way of buttering up the witness before she takes him out. Thank you for being thank you, jury, for being so patient with this highly technical. We're all learning a lot here.
Super genius witness we have
such
here.
a genius.
Variant. A normal person with no genetic variant in with no genetic variant, the nonsense-mediated decay process would help get rid of damaged cells.
It helps get rid of, when you were converting DNA to RNA, that process is not always perfect and it can make mistakes. So if it makes a mistake and it puts in a premature stop codon, you'd rather get rid of that thing. But also this protects us from diseases, because you can often tolerate the loss of one copy without anything. But if you have one that has a genetic change in it that is now incorporated into that complex, that becomes a dominant disease.
Okay. So, and this process of converting DNA to RNA being imperfect, can that be imperfect even in people with no genetic variants at all, or is it solely related to genetic variants?
To have to put in a stop codon where it doesn't belong because of a copying error happens in us all. We're doing this all the time. We make mistakes in copying, and those mistakes get caught. If it's put in a premature stop, it's getting caught. If it puts in a different amino acid, that may not get caught.
Okay. So then is it fair to say that this particular variant that Emma Hernandez has could interfere with her body's ability to get rid of problematic or damaged cells?
No.
Okay, tell me then where this premature stop is, what problem that could potentially cause.
So it wouldn't necessarily cause anything, or maybe a good thing. So if you're making this messenger RNA now that has a premature stop in it, the ribosome, which makes protein, is reading this messenger RNA and reaches that stop codon, and it reaches it too early, and there's a mechanism for getting rid of messenger RNAs that are big and long and have premature stops.
That's what she said.
If you didn't do that, then you'd be making a shortened protein, which might cause problems. So you're getting rid of it. So it's got nothing to do with the cell survival. If you made an abnormal protein, it's not necessarily going to kill your cell. It's just going to make your collagen fiber wrong. It's going to make it too short. It's going to be incorporated into complexes wrong. And that could cause dominant disease.
Okay, and thank you, doctor. Your patience with lay people is greatly appreciated here. So the risk of a variant like this that does have the premature stop is that it could allow abnormal proteins to exist in the body longer than they would have otherwise, which could interfere with collagen fibers and matrices.
No, that's not what I said.
Okay, sorry.
So the premature stop, if it's occurring that early and causes nonsense-mediated decay, means that protein product's not being made. So that whole RNA is being destroyed fairly efficiently, and you're not making the shortened protein. It's just not there. So the other copy is producing all of what's needed, and depending on how much you need. There's some proteins that half normal is not okay, but there's some proteins where it's just fine. You can do with half the normal amount and you got nothing.
Okay, so for some abnormal proteins, it's okay to just have half as much in your body.
Yes.
But
yes,
for
Catherine,
some other abnormal proteins, only having half as much could potentially cause other issues with collagen fibers.
It's the normal protein that you've got half as much. So it's not an abnormal protein, it's a normal protein and you have half as much. Let's take an example where this occurs. So in typical osteogenesis imperfecta, there are 2 genes that code for type 1 collagen. And you have one copy of the protein that comes from the alpha 2 gene, and two that come from the alpha 1 chain, and they form a triple helix. They wrap around each other. If you have one copy of your
Is that me?
No.
Or is that Megan?
Must be Megan, because I
think
can
it's
hear
Megan.
Oh.
Oh no.
Well, folks.
Something happened. I mean, we probably put her computer to sleep. I'm not gonna lie.
This guy's pretty rough, man. It's pretty rough.
It's the DNA stuff with DNA sequencing. It can be difficult to follow, like when you don't have it in front of you, just trying to follow like the sequence.
Yes. And honestly, I think it's harping on it a little too much. For me, it's kind of like, just let's get to the basics and get out of here.
Yeah, I think
either.
Yeah, I'm reaching the point where I'm like, I'm checking out, and I'm even trying to follow the DNA stuff, and I'm like,
we care, and we're checking out.
And it's just like, oof. Oh wait, did she?
Like, how do we find her?
I wonder if, let's see. It was either the wrong, well, okay, so I don't know how it is up there. We're getting some like thunderstorms and stuff rolling through. So it could be the internet got knocked out, because that happens. Oh, it's our show now. Welcome to Not the Megan Fox Show.
Oh no, for Megan.
Oh my goodness.
She should be back pretty quick, actually. Now that it's fully.
Oh, she did lose internet.
Oh,
she did lose internet. Okay.
Okay.
But in the meantime, so how soon after do you testify? Because I'm like, I just want to get to when you testify.
And I'm nervous about watching it because I haven't seen myself. I think I'm the 3rd or 4th defense witness.
Okay.
First one is going to be really boring. Dr. Krishnamurthy. That will not be good. Hi, Meg.
Well, I lost the internet there. So
we kept it going. Don't you worry.
Yeah, thank you. I appreciate that. There's no explanation for it. It just went out, and I guess it's back now. If that happens again, I'm probably gonna just call it quits.
Sure.
But Fluxx, I will send you a message if that happens again, and you can sign off. Let's actually, no, you can't.
I can't. You're streaming.
I'll be the one that has to do it. Oh my God, this is annoying.
In that point, though, you just have to get like a background song playing so people can just sit in your empty stream and like, you can get all the people that just come to watch the empty stream.
Unfortunately, if I'm not in here, then it doesn't. It won't play anything.
I think your internet got bored to death from our witness.
Yeah,
that's possible. But the witness,
I thought
bored the internet.
I thought your computer went to sleep.
I'm writing your internet a cease and desist. No, that's the problem. It's ceased and desisted.
They don't have fractures of babies usually, but and certainly there's different kinds they do. But that actually causes disease. We pick it up, we treat it. It's easy to detect on genetic testing and on the x-rays. So we treat those people. That's the difference. So it really depends on the particular gene you're talking about as to whether nonsense mediated decay is great or not. A mutation that causes that may produce nothing. Just like a deletion, a removal completely of the entire copy of the gene may not produce anything.
Okay. So that is the call 12A1 C.2320C2T parentheses P.G
GLN
774 TER.
Yeah, or STAR. Yes, STAR is the current terminology.
Gotcha. So that is either likely pathogenic or a variant of unknown significance.
Right.
All right. And then we've also got the call 12A1C. Wait, am I supposed to put the star in here again, or?
No, there's no star for that one.
So dot 1163C.
Sounds like they're playing bingo.
And then P dot
bingo.
THR.
Boring bingo, not Megan's bingo.
Okay.
Yeah.
Definitely not.
And so this one is also on the call 12. And it has been found to be either a variant of unknown significance or likely benign, right?
Yeah, it depends on the lab that's reporting it out. And then from the exomes that were done, it's not the other exome that was done with both parents, they didn't report it out at all. Neither one of the COL12 variants. And the reason for that is the information given to the laboratory was fractures. And neither COL12 doesn't cause fractures.
Look, I'm just saying, as a member of the jury, I've checked out. I don't know what he's
Yeah.
talking about. I don't care. And
we were talking about that when you were
yeah.
gone.
Yeah.
Even Catherine's prolonging it too much, in my opinion, because it is so above any of us. I just feel like she should ask some of these questions to the defense geneticist instead of.
Yeah, this is too technical, and you're boring me. But I don't think it harms. It's not harming the case in any way, because I'm just not paying attention in the jury box. I'm now doodling in my notebook. I am drawing pictures of the prosecutor that are not flattering.
You want to know what's on my head on repeat? Blame
What?
Jeremy.
Blame
And I'm blaming you for
Jeremy.
that.
Do do do
No.
do 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 do.
It's such a catchy little jingle. Blame
True.
Jeremy.
It's going to get so good once the defense, when
cannot
testifies. I think I didn't get to hear him because I was right.
God, it's too bad we're not going to get to that today. We aren't. And then we're not going to get to the defense case until I get back from taking my daughter to her thing in North Carolina. So
that'll be something for everyone to look forward to. Well,
yeah.
When we're done with this.
So we will not have another stream until next week, guys. I hate to tell you that, but my summer schedule, you guys know, those of you who've been around for a while, you know that my summer schedule is pretty hit or miss, right? I keep my night shows up, but my day shows are going to just get interrupted because the children are home from school and there is just a lot of stuff for us to do, and there's life to be lived off the internet. So that's what I will be doing.
The good thing is the trial's over, so it's not like
Right.
we're trying to.
We're not missing anything.
The moment we're not. It's over. So
yeah,
it's just recaps for people.
It's recaps. We're catching up. So I do apologize that it is going to be a little bit of a slower schedule than it has been. But that is just the reality of life with kids in the summer. So there is no babysitter. There are no camps. It's just me. So it's just me entertaining them and spending time with them because I don't get to. I like summer. I enjoy it.
Yeah.
Yeah, in my mind, I'm going to Carolina. Yep, good song. Love that song. I just saw James Taylor in concert last summer, and it was amazing. And in fact, we were at Darius Rucker Saturday night. So our summer has already kicked off, which means that we are. I'll be slowing down a little bit. I've got. Yeah. Did you guys see my my landscaping that I did? Hold on, let me show you.
Was it on Twitter?
No, I didn't put it on Twitter. It was on Locals. Hold on.
Oh.
Oh, what? No, don't take me out of what? No. There. Okay. What in the world? I swear to God. All right.
Your computer really doesn't want you to finish his testimony.
I know. It's so boring. It's so boring. God. All right. So I have this area that comes down this big hill. That's my thumb. That's not water on the right-hand side of the screen. It's this big area where this hill comes down and all the water and soil rushes down and comes onto my porch, which is beyond this climbing hydrangea thing. And it's a whole problem. And I've tried to grow some plants there, but as you can see, they're not doing great. So I consulted ChatGPT about what are the plants that I should buy for this particular problem so that it, stops the erosion and sucks up the water. And, yeah, see, look at this. This is what it looked like before. And then I consulted ChatGPT. It told me to buy this stuff. So we got
oh yeah.
God, I can't remember what these are called. They're sedge grass, a Godzilla fern, which gets really big.
I love Godzilla ferns.
And I forget what these the ones with the flowers, they're all the same kind, the dwarf ones and the big ones. I forget what they're called now.
Are they like
Stilbees. There is Stilbees. Okay. And so I went and spent a ridiculous amount of money on these plants because plants are just insane. I don't know if you, and especially because of how big they are. This is what ChatGPT imagined for that space.
Looks good.
Except it put the Godzilla fern over here. I ended up putting it over here because that's where the most of the water goes. And so I'm hoping it'll block some of that. But this is what it imagined. And then I spent 6 hours putting it in. And let's see if I can find my after picture. Where is it? What? I can't get into the after picture? I should be able to. It's not letting me see. It's not letting me see my the chat, which is weird because I have show chat history turned on. It's in the chat. Dang it. And now it's just not letting me do anything. God darn it. All right. I'll find the after picture while we finish watching this guy and his awful testimony. Let's speed him up a little.
Okay. So,
oh yeah.
do my best here on a layperson. The THR in this variant stands for threonine. Threonine.
One of the 20 amino acids. Yes.
Okay, so that's an amino acid.
Yes.
And what would it mean for this position to be a highly conserved domain or highly conserved?
It depends. So highly conserved means that it's present throughout evolution. It tends not to vary too much, if at all. But then you have to look at what's the normal database for human beings. Because what you see in evolution isn't necessarily the same as you see in human beings. Is it tolerated in human beings? So this particular variant is actually seen in human beings. It's in the normal database. It's not a common variant, but it's there.
Okay, so highly conserved means there's not as. So highly conserved means this would be a rare thing to have a variant on, I guess, because everybody needs the threonine amino acid.
Highly conserved means through evolution. So if you look for col 12 in the animals that have it and you look through it, they tend to have the same amino acid or something similar. And that's what highly conserved means. So it doesn't mean that a mutation at that place, a particular variant at that place, actually causes disease. It's one of the things that the computer programs use to sort out whether something could be disease causing or not. You know, the programs, they all overlap with what they consider the predictive value, you know, how well they are at predicting whether something actually causes something, is about 60%. It's a little better than flipping a coin. So it's not something to hang your hat on. So you would say variant of unknown significance, or if you're seeing it very much in the population for what is a very rare disease, you'd say it's likely benign, and you wouldn't even report it out.
Okay, but would it be fair to say that if there was a variant found in Emma Hernandez that was not highly conserved, that would be a factor that you would cite in saying, we don't think this variant is going to cause any problems?
So I would look at, is it there in the normal database? Yes. Does she have the disease? No, it's not important.
Well, right, and so you keep saying she doesn't have that.
That's right.
But just for a minute, step back and forget that you had talked to Dr. Messner and made these conclusions.
I didn't talk to Dr. Messner.
Oh, you never talked to Dr. Messner?
No.
You just read his impression?
Yes.
Okay, so when you say she doesn't have the disease, what if you were trying to find out what might be going on with Emma Hernandez from a genetic research perspective? My question is, if her variant was not in a highly conserved area, i.e. not something that evolution treated as very important to preserve and protect in the body, would you cite that as a reason for this variant probably wouldn't cause Emma Hernandez any problems?
So you've got the reports can't take this stuff into
Can I
account.
possibly get a yes or no answer?
No.
Oh.
Okay. Thank you. And you can, of course, explain your answer.
So you have to look through this and say, okay, how does it relate to my patient at hand? And my major decision when it was coming to collagen 12 is she doesn't have the diseases associated with collagen 12. So that's off the list. The question is she even a carrier for anything?
Did he
So
say
I can
that?
tell the parents.
That does not make any sense.
No.
Probably never get an
doesn't.
answer why he thinks he can say that, but I'm just going to ask it anyway.
No. I don't know.
Like-
Let's look at my garden instead. All right. So
Yeah.
So I put all the plants, that was all bare. I put all of those plants in. Of course, they'll grow up and to be bigger. So all of them are there. And
Good
then
job, Megan. That looks
know.
good.
It took me 6
looks
hours.
pretty.
6 hours to get it all in. And I'm not done because obviously I still have to do mulch, and I am pulling out I'm pulling out the stones. So I have these big stones that are going to be I'll create like a little stone wall around it.
Oh.
But they're very heavy, and so 6 hours of digging in rocky dirt was enough for me. But this is what I did this weekend. So I'm all excited
What's
about it.
worse, listening to this witness or digging up?
Oh,
giant
I choose
stones?
rocks every day, all day
Rocks,
long,
yeah.
every day, rocks.
Same.
Digging in rocky ground is so much better than actually digging holes in the ground is better than most things, to be completely honest. I go back to office space, and when that guy finally goes to work for a construction company, he's like, fucking A, man. Fucking A. Like, they're outside. He's like, I'm outside, moving heavy shit.
It's
like,
freeing.
life is
It's
pretty
freeing.
good, life is good.
People have gotten so far away from that physical work, where that day of hard physical work, it's hard
Oh,
and it
it
hurts,
feels
but you
good,
feel
and then
so
you sleep.
accomplished.
Then you sleep
Yeah.
good too. Like
Yeah.
and this is another reason why I'm going to be slowing down my streaming, because again, I have to remind myself, when I sit too long, I get into physical pain. I would much rather be in physical pain from heavy labor and
Productive
moving
work.
than sitting on my ass
Yeah.
pain where I'm just flattening out my gluteus muscles. Honestly, I can't stream twice a day. Like, it's too much for me. It's too much. I'm too old for this shit. I'm too old for this, and I can't do it. And I can't.
Hey, you're smart for acknowledging it and running with what you have to do.
I do. And I have to remember that just a year or two ago, I was nearly bedridden in pain because of my neck. If I don't move enough every day, I will be back in that place. So now that I'm feeling better, I can't get stuck back in sitting too long, or it's a vicious cycle. It'll keep happening. I have to walk every day. I have to move every day. I have to lift heavy things, squat, do all kinds of things, or my spine is very angry with me. So the sitting thing
we
is
support you in that. We
just
support
not
you.
good. Yeah, I mean, it's like in the winter,
We, like your
you don't,
spine, support you.
yeah, in the winter, I don't have a lot of opportunity. I have to go to the gym in order to do all the activity and the moving.
Yeah,
But
get
in
out and get your vitamin D.
In the summertime, there's work to be done
Yeah.
outside, a lot of it. So there's never a shortage of stuff to go do physically outside, and it's just better for me in general. It's better for my health. So I have to get it. I have to my husband reminded me too. He's like, you will feel better if you're not.
Yeah, it's
screaming.
true.
It's true. It's just true. I do. So yeah. All right. Back to this guy. God, I wish I was outside right now. That's exactly what I'm going to do.
This is like getting.
It'll be over soon, though. Like
it's not going to be over soon. There's like 40 more minutes. All right,
once this guy's gone, when he's gone, it'll be better.
Like triple time
I
this.
can reassure you, she doesn't have the collagen 12 disease genes. She's not got this condition.
We
It's
don't
not a
understand
problem.
what he's
She doesn't
saying
have the physical
anyway.
features of it. And then it's
That's a
okay.
fair
So,
point.
and it didn't cause the fractures because
That's
it
a
doesn't do
fair
that.
point.
And then it's okay. What does she a carrier for this? And that's what I sorted through with my analysis of this particular stop codon, a premature stop. That because she doesn't have it, and neither does the parent that carries it, this is going to be at most a recessive mutation. Most likely, it's going to be a recessive mutation. So it means you've got to have a second variant in that gene to cause disease. And the second variant she doesn't have that severe disease. She doesn't have a disease at all. So that second variant is very likely benign, which is the way that Invitae categorized that other variant as likely benign. So that's how I saw
these words like likely are not helping him with the jury. In my mind, on the jury, I'm like, likely doesn't mean for sure. Likely means maybe, means maybe.
I agree.
It means shit.
To try and determine what to inform the parents about her carrier status. So she's a carrier for the recessive disease at most. She doesn't have either the dominant form, the milder dominant Ehlers-Danlos form, or the severe ulrich form.
Okay. And you are basing that conclusion about what to cross off the list on your examination of Emma?
My examination of Emma, yes. And also, how in the heck does that relate to the fracture she's got? That's a major question at hand here.
And
it doesn't.
Sticky widget. I know what you mean. Every time I have to hide a body, I think to myself, it sure is a nice night under the stars with the moonlight and a nice cool breeze.
You know?
That's the way to look at it, you know? In every aspect of life, no matter what you're doing, it's always nice to be outside.
okay, so your position on these collagen producing genes is that these variants that she has 2 of on the gene, just no effect on Emma Hernandez.
That's right.
Okay.
She's a normal kid, at least when it comes to her bones.
And connective tissues?
And why did y'all give her a feeding?
She is normal in examination when I saw her. Whether she's going to have something
extra
when she's
vitamin
older,
D.
I can't say.
We saw her a year and a
Connective
half
tissue
later.
disorders are very varied, and some of them appear
Oh my God.
over age. They have nothing to do with your bones.
Why is he
but
even
they
relevant
appear
at
over
this
age,
point?
like Marfan syndrome. She could have Marfan syndrome. I couldn't tell at birth.
So if you had any additional information regarding the recurrence of markings and discolorations on her skin, no matter who she was in the custody of care of, would that have any impact on your assessment?
Not of her bones, no. Not of the fractures and what was responsible for it. It may tell you she's got something that causes her to bruise easily.
But that would, the same things that affect the connective tissues are just not going to affect the bones?
Not in this case, no.
And one of the things that you were using to draw your very firm conclusions about Emma Hernandez normality is the parathyroid level, right?
That's relating to vitamin D.
Okay, because it is possible for there to be conditions where there's both a genetic and a non-genetic component that combine into producing a particular effect on a particular human body, right?
Genetic and a non-genetic, yes. If you had osteogenesis imperfecta and you're vitamin D deficient, you're going to be worse.
Okay, so but one of the ways that you have drawn the conclusion that that is not a factor for Emma was the parathyroid hormone, if I understood you correctly.
Parathyroid hormone, alkaline phosphatase, and lack of rickets on the X-ray.
Okay, and so when was Emma's parathyroid hormone tested?
It was during that initial hospitalization with the initial fractures.
Well, so you included in your report a very helpful chart about all of Emma's different hospitalizations, right?
Yeah.
And I believe you're probably grabbing it right now to refer to.
Yeah, I've got a couple of things at all of her tests.
And so what you put in your report, was that all of the information that you had available, or was there any additional information that is not included in your report?
There's a lot of labs that she has that are in the children's system. It's too big to actually stick on a single piece of paper.
Right. But
Still
so
healthy.
for parathyroid hormone, which is PTH is how you summarize it, you got her having a reading of 37.8 on July 23rd of 2023, right?
Yeah, I need to look back through this. I can't.
And I'm on page 16 of your report. If that's
Looking through my printout of the children's system. What's up here? Here. Let me look at this one.
A lot of silence, and you have it
Or
sped
it's on
up.
6/7/23.
I know, that's what I was just thinking. I'm like, this has been.
37.80, which is normal.
Okay.
Are we on 0.15 or 0.1?
1.5.
And you put that down as the July reading as well?
Do I have the July reading on here? Let's see. I don't see a July reading on my paper here. So the one I see is from much earlier. This is more relevant than what it would have done later.
And none of the other labs were concerning to you at all, despite being outside the reference range and normal levels?
She had some D-dimer, which would come from bruising, but nothing else.
Okay, but her D-dimer level was way, way, way elevated, wasn't it?
No, you haven't seen sick patients in ICUs. You're going,
So what would be way, way, way elevated?
No, it'd be up in the 5,000-10,000 range, so it comes up much higher than that.
So like the 1,700-1,800 range is
It's perfectly anticipated for somebody with bruising. It's not specific.
not specific. And I suppose, okay, so the normal reference range is 0 to 220 nanograms per milliliter, right?
Yeah.
So 1,778 gives you no concern?
Well, I mean, she's got something going on with clotting.
Oh.
Something going on with clotting.
Yeah, she has clotting, and that can come from bruise.
And
which,
she had no bruising at the time
pictures in the
that
report
that was
from
taken.
children, she had bruising, so it's not unexpected.
And the fibrinogen, same deal?
Yeah, that's actually elevated, which can come from stress.
Yeah, we stressed her the fuck out. So yeah, that's
no
definitely
kidding.
going to happen.
Like the time that she's brought in on June 6th, there is no bruising. Remember? Like the picture behind the bruise behind the ear, that was a week before, and then the markings on the bottom of her feet are not for another month. So there's no bruising on this baby when her D-dimer is elevated, which he says, well, that's understandable. It can be from bruising, from clotting. But there is none of that going on.
So, but it doesn't give you any concern about the manifestations of collagen production in her body?
It's got nothing to do with collagen. The elevated fibrinogen just makes you more likely to clot.
All right. And so we've got the two fall 12 variants. And then what about this, the one that starts with S, which I do not have?
SLC34A1.
That's exactly the one, the sodium phosphate co-transporter.
Yes,
And you concluded that's also not relevant
That's
to
right.
any potential damage or issues with Emma Hernandez's body.
that's right.
Okay, so are you concerned about the issue of phosphate reabsorption at all in terms of its effect on bone health and quality?
Not with her, no.
But would you generally be concerned with the idea of phosphate reabsorption as it relates to bone health and quality?
Sure, we see kids with hypophosphatemic rickets. So they have low phosphate levels because they have a mutation in a gene that's required for phosphate reabsorption. It's different than this one, and they develop rickets over time.
Okay, so how is it, so you're saying the SLC34A1 gene, which I believe has been characterized as a variant of unknown significance by most of the labs, right?
That's right.
So we don't know if it's benign or pathogenic at this point.
It's a variant of unknown significance in the reports where it exists. It wasn't reported out whatsoever in the exomes.
Okay. So, but it does encode the sodium phosphate co-transporter, right?
Yes,
And so it would have an effect on phosphate reabsorption, right?
if it's pathogenic.
Okay, and that is a question that nobody knows the answer to at this point.
Well, you might be able to answer that by testing parents who has it, and do they have anything in their kidneys if they had stones? And that's what you get from this when you're younger. You'll get stones.
And then she's also got the CFTR mutation, but she doesn't have cystic fibrosis, right?
No,
So, she doesn't have the mutation, or she doesn't have the cystic
she doesn't have the disease. She has a mutation. She's a carrier.
Okay. So we've got the 4 genetic variants, one of which is likely pathogenic, one is likely benign, and 2 are variants of unknown significance.
Well, there's other genes where they have variants of unknown significance too. They're in this VDI report, but they don't cause anything that is the slightest related to what she has.
Okay, well, I'm just for completeness' sake, we do have, so how many other variants did Emma Hernandez?
5 other ones.
Okay, and that's the ADAM TSL4,
Yes,
C1S,
yes,
FOXE3,
yes,
LTBP2,
yes,
OSTM1,
yes,
and then the SLC34A1 that we already discussed, right?
yes.
Okay, and you think her Thai ancestry may be a factor in our lack of understanding of the significance of those particular variants?
You're more likely to get variants of unknown significance if you're not white.
All right, so you did your report, did you do your report the same day that you saw Emma?
It took a few days to work on it, gather all the information together, and make sure that that it was Carol.
Okay. And then did you speak to Ashley Smith while she was at your office, the DFACS worker that was with y'all?
She heard the whole thing. She was there for the whole thing.
Okay. And you put in your report that the mom stated that Emma has been constipated since being in foster care, I guess thinking that gut issues might be relevant to your determination, right?
Sure.
But Ms. Smith reported that no other caregivers, including her current foster mother, have noted any constipation issues.
Sure.
So.
Well, is it fair to say that Ms. Smith, the DFACS worker, was there telling you everything has been fine with Emma since she has been taken away from her parents?
Constipation has nothing to do with what I'm evaluating.
Well,
it's common in
What?
kids.
Sure, but my question
Including
is,
mine.
the DFACS.
Again, if you are talking about a connective tissue disorder, it necessarily comes with all sorts of other things, including GI disruption, because nothing is held together properly by connective tissue. Do you understand that? You can get a lazy colon because the muscles and the contraction that usually works to move stuff through doesn't work. What the hell is he talking about? I'm sorry, I'm screaming, but I can't.
Stupid.
I can't handle this. This is supposed to be an expert in EDS. You are full of garbage. My daughter belongs to an EDS support group, and every single person in that group has a GI specialist. Why? Because there are problems with the GI that necessarily are caused by connective tissue disorders.
I would agree with that. All the families that I can think of that have an EDS diagnosis have GI issues.
Yeah, it goes with it. It literally is on the thing when they're asking you all the questions. GI disruptions. This is just so garbage. You don't know anything about what you're talking about.
Worker was the one telling you, oh no, Emma hasn't had any problems since we took her away from her parents, right?
No, my blood pressure meds are not working. No. Go ahead and check it off. And I did take them today. God darn it.
In with a grain of salt that you're told.
I think that is a very wise counsel. But again, that's what the DFACS worker, Ms. Ashley Smith, was doing.
She's representing to me. The one thing I really wanted to know, if she had any more broken bones. That's the most important thing. Everybody said no.
Why would that be the most important thing?
Because it's only child abuse.
X-rays. Right. And she didn't have any more x-rays. So
how would they know?
No clue.
Wow.
That's
No
all he
clue.
cares about.
And apparently my blood pressure meds are working. My heart rate is still really low. I don't know. But I'm going to give it to you because I don't feel like it's working. So I feel upset.
Not had any other significant health issues after being taken out of the custody of her parents on June 8th, correct?
Yes.
Okay.
But I don't know what her knowledge of everything is.
Okay. But that is, I think we've got everything we need. Thank you very much for your time, Dr. Wilcox.
Oh, thank God.
Oh, please.
No, Steve is coming up now. We're not anywhere near being done.
Oh, I thought we weren't getting. Oh.
It's not going to produce symptoms in the fetus. That's not my question. Well, it's a relevant question for what you're asking.
Can I have a pregnant woman, can she develop and transmit a prolonged vitamin D deficiency to her fetus?
Yes. No, not what you're saying. Can the baby be born with vitamin D deficiency because she didn't get anything from mother?
I'm talking about in utero.
No, it's not going to cause disease in utero.
I'm not talking about volume disease.
That's the important thing.
I'm talking about vitamin D deficiency.
Holy shit.
You're saying vitamin D deficiency.
He wants to fight now.
Yeah,
we
he
gotta fight. We gotta. All right, we're gonna have to slow it down a little bit because we're gonna. They're starting.
Hear it. Steve comes in like ready to go, doesn't he?
Yeah.
Wow.
Hey,
They're gonna fight. Ready, everybody, get your popcorn. We got a real fight. It's a fight.
I'm ready for it because I've been bored.
It can't develop in utero?
That's right.
A mother's vitamin D status directly impacts the developing fetus, and a prolonged deficiency can lead to various health problems in the child.
Maybe outside this country.
What?
In the third world, not here.
Holy shit!
Are you kidding me?
Did this guy just make a third world joke?
No.
Somebody alert the media that someone is talking bad about the third world. Holy cow!
Wow. I thought he was hostile before. He is doubled down on the hostility.
Third world.
He's got a doctorate in hostilology.
What a dick
Holy
has been
shit.
called. What a dick. Also, I think unfucking real should now be called Because this is really, I can't believe he
saying
just
a
did
lot of crap all at once.
I can't believe he just did a third world dig. I can't.
The mother?
Ding, ding, ding. Start the rounds.
Holy shit.
We need a ring girl. We need a ring girl to walk by. I need a video with a ring girl that walks by. I'll ask Grok about that.
Oh, I was gonna say, are you gonna do one of the fleas from Grok?
God, no. No one needs that.
The fetus is really good at taking calcium from the mother. Very good at it. And the role of vitamin D is to absorb calcium from your gut and preserve it from your kidney. But that's not an issue in a fetus. They got a dialysis machine pulling stuff from mom.
Even if mom had kidney stones?
Even if mom had kidney stones.
Even if mom was vitamin D deficient?
Even if mom's vitamin D deficient, the baby will take calcium from the mother to the point of causing problems in the mother.
Even if mom's anemic?
Anemia's got nothing to do with it.
So you're saying that vitamin D deficiency can now occur in you?
Not to cause symptoms in a baby. Right, not in this country.
So why is it that vitamin D deficiency in the womb can lead to long-term health effects?
The babies make up for it as soon as they're born. They've been taking calcium from the mother at a pretty high rate, and then they're born. If they got vitamin D deficiency, they should be treated. So if they're breastfed, mommy isn't providing any vitamin D, and they usually don't provide enough in breast milk anyway, they need to take supplemental vitamins. If they're on formula, they're getting vitamin D in the formula.
And breastfed would raise a higher risk of vitamin D deficiency.
Yes, yes.
I heard you testify about the DEXA scan. You said scan. I'm just trying just quick clarification. The results on the DEXA scan are inconclusive, correct?
Because there's no norms for babies that age. That's right.
Well, and also the baby, there was artifact motion, right, during the DEXA scan?
Yes.
I didn't hear you testify about that earlier, though.
No.
Why not?
Because they provided a number. So it's all right. There's some motion artifact, but you got a number. So let's look up the number.
But is that valid? Is that number?
It's not doing even a DEXA in a baby that age is not valid. So it's useless. They shouldn't have done it. They shouldn't have ordered
Dr. Chan testified here today. You can do a DEXA scan in a baby.
You can do anything. Lots of tests in a baby doesn't mean you can interpret the results.
Holy shit, this guy.
Oh.
Wow.
Jonathan was talking about. He's so mad.
Holy shit.
All right. Why can't we see it? Where the hell did it go? I have my ring girl, but I can't see it. There we go. Nope. Am I having internet problems again? There we go. There she is.
Nice. Holy shit.
But some doctors would disagree with you that you can't. I heard you mention you don't do DEXA scans in babies.
We don't do DEXA scans in little babies.
Never.
Oh, somebody might. Yeah, you can. It's the machine will accept you into the machine to pass x-rays through you and measure something, but there's no norms that come out the other end that are useful. So the radiologist will say it's not interpretable.
So if we prolong vitamin D deficiency in the womb, right, leading to long-term health effects, some of those health effects could be an increased risk of asthma. I think you spoke about that.
I did not.
You did not. It can lead to increased risk of asthma, right?
I did not say anything about asthma.
I'm asking you.
I don't know about asthma.
Okay. Can it lead to multiple sclerosis?
I don't know about that.
Okay. Type 1 diabetes?
So because he doesn't know it means it can't happen.
Doesn't work.
It leads to
Yeah, it
dental
can't
enamel
happen.
defects and lower bone density.
Enamel isn't bone. Enamel is a completely different problem.
I'm not asking you if it's enamel. No, I'm asking you if vitamin D deficiency can lead to enamel problems.
No.
Oh, you liar.
Oh my gosh.
Oh, you liar. You liar. Wow. Hold on.
Wowee.
Yes, a deficiency in vitamin D can contribute to enamel problems, especially if the deficiency occurs during tooth development in childhood.
Mm-hmm.
This is common knowledge.
That's common knowledge, 100%.
Holy
Yeah.
shit. This guy is such a liar.
People stay away from this guy. Stay away from him.
Bad doctor.
I don't know about that. I don't know everything about every endocrine problem on the earth.
You don't know anything about anything. You didn't even know about enamel problems and vitamin D deficiencies. Every mother pretty much knows about that. Come on.
Can it lead to SGA? Small
Objection.
gestational age?
Objection. I don't understand the relevance of it.
Objection. Objection has been called.
Finish up. I'm not a perinatologist.
The vitamin D deficiency can also lead to developmental delays, right?
If you're vitamin D deficient at rickets, yes.
You agree that vitamin D deficiency can affect bone fertility, right?
I am going to go ahead and call off witness seething. The witness is seething.
Yeah. He's breathing funny now.
Now he's breathing hard.
Mhm.
Holy cow.
For the long term, yes.
Oh,
You
perjury.
don't believe that it can develop in utero.
Perjury is also there, and I think that vitamin D question was perjury. He
Yeah.
knew
Honestly,
damn
I
well.
agree.
He knows damn well that vitamin D deficiency can cause enamel tooth problems in babies. What a liar.
Well,
Liar.
if he doesn't know, he shouldn't be seeing children. He
And
shouldn't
also
be seeing patients.
state lies can be checked off now too. State
Yeah.
lies.
Always.
What an absolute buffoon.
Right.
No.
Thanks.
Dr. Wilcox, you mentioned clotting, and I just want to kind of clip in reference to bruising. I just want to clarify. Does Emma have a clotting disorder?
Not that anyone's identified. No.
And I want to also talk about the anemia because defense brought it up, and you said anemia has nothing to do with it. Can you explain if the mother has anemia, would that affect a child's bone health?
The mother has alpha thalassemia minor. So that's a mild anemia, very common in Southeast Asia, and doesn't have any real effects on your health. It's not going to affect the fetus at all. They get plenty
Doesn't
of
have
oxygen.
any real effects. They always add those
You said there were tests that you
qualifiers.
saw after you saw Emma in clinic. Was there anything about these genetic tests that would make her more prone to fractures?
Nothing was found. The test was negative.
Does this child have rickets?
No.
And was your diagnosis of this being non-accidental trauma dependent on Dr. Messner's diagnosis?
No.
Nothing further.
Any other witnesses, Ms.
There
Healy?
you are.
All right, subject to the admission of this document, what is the state's announcement at this time?
State of rest.
All right. Let me ask the defense, as far as witness
Say
availability, it's my
Wait, this,
understanding.
like,
Is
rest?
there anything we can do today, or
Now it becomes the defense's case. Remember, I told you this is their last witness.
Yes,
So the
I just-
state is finally resting.
But there's still several
The
minutes.
ADHD
What are
made
they
me
about to
forget.
argue here? What
I
are
don't
they
know.
about-
There's still we still have time. Something's going to happen.
are we looking at Monday?
Yes, Your Honor, we have our witnesses available starting at 2 o'clock today.
2 o'clock today? Okay, very good, thank you. As such, the court at this time denies the directed verdict.
Oh, they put in a
Yeah,
motion for
knew
a
that.
directed verdict. That the
Knew
defense
that,
usually
yeah.
does that.
They
We would-
knew that that was not going to fly.
It never
Yeah.
flies. It hardly ever flies.
All right. What else do we need to do? We got a motion to eliminate from the state.
Yes, Your Honor.
Oh, here
You
we
may
go.
proceed.
Thank you. The state filed a motion in limine to prohibit testimony of counselor, psychologist, or therapist, or really any other witness that would be testifying as to the parental fitness of these defendants
Here we
and
go.
the children's desire to go back home to the defendants, Your Honor.
Can't let the jury know they
state's
want to go
position is
home.
That is improper character evidence. If there are any statements made by the children that would fall under hearsay and does not fall under the child hearsay exception.
We
either.
don't believe
And
children.
it's also irrelevant as to this case.
It's irrelevant to this case.
Oh, it's irrelevant.
so-
Okay.
Mr. Wassley, Mr. Bernard, I don't know how you want to address it. I don't know if we need to go by specific witnesses or general, or how we need to approach it.
I'll just generally go, if you don't mind, Judge.
That's fine.
I think this is an easier question, quite frankly, for the court, based on the changes in character evidence that took place. Under the old law, before the rules of evidence changed, I would say, they'd have a better argument, but under the new evidence code, OCGA 244404A provides that evidence of a pertinent trait of character of the defendant is admissible if it is relevant to the offense for which he is charged. The offenses in this case, we all know what they are. Also, OCGA 244405 states that evidence of a pertinent character trait can be offered via testimony as to the defendant's reputation, or testimony as to the witness's personal opinion of the defendant. OCGA 24405B provides that when the character or a trait of character of a person is an essential element of a charge, claim, or defense, or when the Georgia Court of Appeals held that this rule applied to a child molestation defendant, where his good character was an essential element of his defense. This was a major departure from the previous appellate decisions in Georgia, which consistently limited character evidence in such cases to reputation and opinion testimony. The court in Goggins, I have the case here, Judge. The Goggins case is 330 Georgia Appeals 350. I believe it's a 2014 case. The court in Goggins permitted character witnesses to testify that he was the father of the year, that the witnesses had no reservations about leaving their kids alone with him, and that they had personally observed him acting appropriately with the children. And the court did not have a problem with that. That wasn't really the ultimate holding in that particular case, but they addressed those issues throughout the case. And I have a copy of the case to my hand.
Yeah.
So one of the new evidence code that came into effect a few years ago, quite some time ago, Judge, as far as character evidence, the code itself, I have a copy of that as well, allows for pertinent character testimony to come in. And the key word there is pertinent. And in this case, I believe it is pertinent given the nature of the charges that the defendants are facing in this case. They can raise as a defense they were good parents. That goes right to the heart of the defense in the case, and that they would never even do something to their children. And I believe that's pertinent in this case. I have the code sections too, Judge, but I think they'll be pretty easy to find.
All right.
Thank you, Judge.
Thank you. Well, Ms. Bernard, do you have anything on this?
I don't have much to add, Your Honor, other than that I would just note that the state's motion in limine to prevent reference to the concept of parental fitness only came after the state got access to the full defects record and was able to see that for 2 years, these people's parental fitness has been relentlessly questioned by the state. And again, they have passed with flying colors.
That's exactly
It is only then that the state decided parental fitness would not be a suitable subject of discussion for a case involving allegations that parents abused their children.
Hideous. Thank you, Catherine.
The core of their defense that they are fit parents. They have massive amounts of evidence to that effect that has already been presented in sworn testimony.
Check off appropriate and loving parents
In courts of the state. And we believe that, as Mr. Wasley has ably pointed out already, it is relevant for purposes of fact as well as character assessment.
Oh, thank you. Ms. Yee, any reply before I step off to look at this authority?
Your Honor, first of all, I think they are misreading 404A, but I do have some authority as well, Your Honor, that I would like to.
She doesn't sound confident about that. She's searching for it.
And that is.
She's reaching.
Brooks v. State 236, Georgia Court of Appeals 604. That's a 1999 case. But in Brooks, essentially the defendant was attempting to introduce a witness to testify that the defendant was charged with child molestation. The defendant was trying to admit evidence through a witness to state that he had a general reputation for acting appropriately towards children, and that he did not have a reputation for molesting children.
She does not know this case. You can tell she's reading
that was a
it.
terrible argument.
She's reading it right now. She has no idea if this actually is the case she's looking for either.
Did Steve say the new law?
Yes.
Yeah.
So she's citing law from 1999.
Right. He said
Steve, on the other hand, is citing a much more
Relevant.
recent case.
The court found that such evidence was inadmissible and said that while the proffer was phrased in terms of Brooks' general reputation in the community, inherent to the issue of whether he acted appropriately towards children would be more narrow and specific issue of his actions towards specific children, and that evidence of specific acts is inadmissible to show a defendant's good character. Along the same lines,
But
there's
whoa. This was testimony about how he behaved with other children who weren't the victims. This testimony is about the parents' behavior with the alleged victims.
Yeah.
That's different. That's not close.
Fike v. State, that's F-I-E-K, and that is 266 Georgia Court of Appeals 523.
Thank you, Nick.
2004 case, where there the defendant was
again, she has no idea,
attempting to introduce a videotape of
reading it,
interacting with.
She's scanning and reading at the same time. She's never read this before. She's just trying it now. I can tell, you know it, I know it, everybody knows it, and that judge ought to call her out. If I were the judge, I'd be like, excuse me, Prosecutor Yee, are you prepared for this argument? Because if you are prepared, then you could tell me what the case says.
Right.
Why are you reading this?
Yeah.
Just bullshit.
With other students, in a normal fashion, and not by way of molestation. The state sought to exclude any testimony by defense witnesses that might be offered to show that Fike had not molested other children with whom he had contact, on the basis that such testimony was not admissible to show good character in the trial.
And now she's talking so fast, no one knows what she's saying. And this is not sped up. This is at one-time speed. She is now speed reading through this case that has nothing to do with this one.
The trial court did not abuse its discretion by disallowing this testimony.
Judge, if I may just add, that's under the old code section. That's
Yeah.
under the 24.402 before it changed. That's under the old code section.
Yep.
The 24.405 subsection B clearly states, in proceedings in which character or trait of character of a person is an essential element of a charge, claim, or defense, or when an accused testifies to his or her own character, proof may also be made of specific instances of that person's conduct. The character of the accused, including the specific instances of the accused's conduct, shall be admissible in a pre-sentencing hearing subject to provisions. That's just an added part. It's also admissible in a pre-sentencing. The bottom line is that pertinent character traits are admissible now under the code section. The way it's been framed, basically following federal law, if I may add. So if I could just approach and present the code section as well.
Good job, Steve. But we know the judge is going to disallow it.
All right, counsel, I'm going to take a few minutes off the bench when I come back.
I'm going to take a few minutes off the bench to decide I'm not going to do it.
Yeah.
Give you my decision. Counsel, I will give you my efforts regarding looking at this issue and seek your input.
Fluxx is going to get angry.
Because in reading the statute, OCGA 24-4-405, subsections A and B, both of those sections start off with, before it gets into this issue that's talking about specific instances of a person's conduct, it says, in all proceedings in which evidence of character or a trait of character of a person, well, let me back up. 24-4.
I can't. Oh my God.
In proceedings in which character or trait of character person is an essential element of a charge, claim, or defense. So it starts off with that condition.
He's going to say that it's not an essential part of this case. That
It is the main focal point.
It's the main point.
But he's going to say it's not. He's going to say it has nothing to do with it. And he is struggling. Yes, he is, chat. You're absolutely correct. He is also struggling to explain why he's not going to allow character evidence in.
Not certain everything that the defense wants to go into. But if it is something that someone wants to testify, a specific instance relating to, say, I'm just going to characterize generally, parental fitness, then that is not an essential trait of character. That's not an essential element of this charge. And it's not a defense.
What?
And so you have to start with.
Let me get this straight. No one saw the abuse happen. There isn't a witness to the abuse. How can character and fitness of the parent not be essential to this case?
it's so terrible. And then like he limits it so much, and the jury misses everything that's good, you know? It's just
This is
it's
crazy.
it's their whole defense, like everything to keep them out of prison, and he wants to keep it away.
For
That
fuck's
analysis.
sake.
And this case that Judge Ray, must have been before he went on the federal bench. This is a case, Mr. Watson, you gave me. I don't know if I have it right here now. Is it Gongle? Goggins. It assumes that the offense of child molestation, that if you read that case, basically what happened is the defendant who was convicted complained on appeal that the trial court gave a ruling that you can't go into specific instances of the conduct. And then as the trial developed, the judge actually did. And there were numerous instances where the defense witnesses were allowed to go into the defendant's character, specific acts saying he's seen him around children, he always acted appropriately around children, father of the year, all those examples, you cited those. And what happened in that case is the appellate court basically says, the defendant really doesn't have much to complain about. He's complaining about trial court saying you can't do it. And in the trial it happened. And so therefore you got your day in court with what you wanted. And the jury heard that. And so that's how that case was decided. Now, admittedly, the trial court, even after they said they weren't going to let the specific instances of conduct in, let it in. But I'm of the opinion that you have to start with what is in proceedings which character or trait of character is an essential element of the charge, claim, or defense.
How can it be not essential? How can the character?
I think there's two issues, Judge, on that, and I think one of them is certainly
come on,
propensity
Steve.
to commit a violent act. It's one of those that a defense that we certainly would believe that our clients don't have the propensity to commit any type of violent act. That would go right to the heart of the defense. That's one of them.
Well, let me cite to you an example in the 11th Circuit in 2023, which gives us direction on that issue. And it's United States versus Sebastian Ahmed, 73 F.
Fluxx had to bounce. She says goodbye.
1363. And it gives us, in that case, and I'm not going to go into all the facts of the case, it's
He can't even find it.
No, he doesn't even.
What was he doing back there for all that time?
let's see. Well, I'm not finding it right now, but basically what it was, there was a cause of action, issues relating to like defamation. And they were allowed to bring in evidence of good conduct, specific instances of conduct of telling the truth, and to defend against the fact of defamatory statement, because we all know truth is defense to defamation.
We ought to just go
what
witness
is he
by
even
witness.
talking about?
I know. Just go by witness by witness.
Why is he
Who
talking
you
about
want.
defamation now? Where are we going?
He's just scratching at the dog.
He doesn't have a fucking clue. Look at him.
No, he doesn't.
And I'm going back to this Goggins case. What I'm reading is that, basically that in Goggins, the trial court allowed this in, but it basically it's assuming that evidence of the defendant's good character is an essential element of his defense. And then if you look further under State versus Edwards, 255 Georgia 149, Georgia courts have held the accused good character is not a substantive defense, while evidence of good character is a substantive fact which should be considered by the jury along with other facts tending to bear on the question of guilt or innocence. Evidence of good character is not a substantive defense. And that's with the on Meade case, which I can't find. Clay, I don't know if you have that.
Well, maybe you should go ask your clerk for more help.
Yeah.
Yeah. Why is he doing this? After going back to chambers to allegedly research this, he should have come to the bench with
his
an
decision.
opinion.
Yeah, absolutely.
Now he's making his decision on the bench. What are you doing? What were you doing back there? What were you doing? Oh my God. This is shameful.
We still, yeah, it is. It's gross.
Judge Dickinson, you should be ashamed.
Basically, I think what I'm recalling is that you can't use good character as to defend against criminal intent.
I'm making it up because I can't find the reference I'm looking for that I think I'm looking for. But what I remember is after Steve just told
2 minutes
him,
ago.
After Steve just told him that there's a new statute, a new law, a new ruling that says, yeah, you have to allow it in a case where it's essential to the defense.
Yeah, and he's saying it's just not essential. It's not important.
But he can't find the reference that he's trying to use, Jen.
It's there somewhere. It's there.
You don't use good character in that manner. So, court, and this is what I want to hear from you.
Whoa. He's making the general statement that you can't use good character references in any criminal defense. That's not true.
That's crazy.
What there are tons of cases
What's the
I've
point
seen.
Of character witnesses. What's the point of that?
What's
Why
the
would you
point of
even
it then? When do you use a character witness? Oh my God!
An essential element of this offense or defense to the aggravated battery, family violence, and cruelty to a person. If we're going to go into, and I don't know your evidence, but if we're going to go into someone wants to come in and say, I've been around them, and they're good parents, or they haven't done anything wrong. I don't think that's allowed.
Why can't the
They
jury
testify now as to just general good character, the way.
Yeah, that's a good question too. Like, why don't? Okay, Grok says no, he's not correct. Character witnesses are a recognized and often appropriate part of criminal defense strategy in Georgia and in U.S. courts generally, though they come with some limitations. The general rule is evidence of a person's character or a trait of character is not admissible simply to prove that they acted in conformity with that character on a specific occasion. The defense exception, which is called the mercy rule, a defendant may introduce evidence of their own pertinent character trait. Example, peacefulness in a violence case. That's what this is. This is a violence case. So if you have no propensity for violence, and that's been witnessed over a period of years by your character witnesses, that's supposed to come in. Honesty in a theft fraud case is another exception. And it looks like those are the two exceptions. This is typically done via reputation or opinion testimony from character witnesses, not specific past acts on direct examination. Once the defense opens the door, the prosecution can rebut it, including with cross-examination about specific instances of bad conduct.
Sure. And why not do that? If you're so strong in your case and you think these parents did it, why are you afraid to let the jury hear what these parental fitness, by the way, who Matt and Taki had to pay for out of pocket? They had to pay these people to do these visits and do these psychological reports.
Wow.
Ordered by the state. And Catherine is right. They didn't care until they finally sat down and read it all. Ye finally sat down and was like, oh no. Everybody said really good things about Matt and Taki.
Oh, God.
At least Jed got it all on camera, Megan. Like, thank God all the proffers that he did when the jury leaves the room, all of it's recorded. So that's like the big blessing here.
Not allow. I have to ask Rock one more question. Testimony of state witnesses who observed.
Right. What if someone
them
had
being
that?
appropriate,
Yeah.
loving parents? Their own, what do you call them? Supervisors reported family was appropriate and good parents. I mean, it's crazy that would not be allowed. It's crazy.
Yeah.
The judge, David Dickinson, excluded certain testimony from defense character witnesses. Yep, including observations from state. Oh, Grok knows about this case. Interesting. Including observations from state defects linked individuals like visitation supervisors. The judge viewed this as more relevant to juvenile dependency proceedings, where the focus is on parental fitness and the child's best interest for custody reunification rather than criminal trial. But yeah, okay. So Grok did say earlier that judges have broad discretion under Georgia evidence rules. And of course, so he can do whatever he wants, even though it's a general rule that you can have character witnesses. And there's an exception for violent crimes. Unreal, which of course child abuse is. This is really sick.
Because if the state had called somebody that said Matt was really explosive and easily got angry and yelled at supervisors,
they would have used it.
That.
Yeah.
They would have used that.
Unreal.
It's so sad to hear. Like, it's just so
This
so
is
wrong.
bullshit.
I guess we would traditionally understand it to be. As to truth or peacefulness. Yes, ma'am.
And yes, I think we do both want to be heard on some matters relating to this, and we appreciate the court's conscientiousness and attention to this. I am wondering if perhaps we might, since Dr. Krishnamurthy is, not a character witness, she's a treating physician and an expert witness. I was wondering if perhaps we could have the jury come in, hear from Dr. Krishnamurthy, and take this up at the conclusion and excuse the jury rather
That's
than.
not.
Or, Judge, I'm happy to brief it completely and write a 10-page brief if I need to. I'll look into it more.
Why don't we look over the weekend? I'll get all sides over the weekend to look at.
Thank you very much.
And I'll be over time.
So gracious.
Section of the case that I'm on, I can't find right now.
Well, we noticed you were taking a little bit, Judge, so we knew you were up to.
Well.
And that's the thing with this kind of stuff.
Well, I understand.
I only had like an hour, last month to do it.
Right, I understand. Well, let's look at it over the weekend. We don't have to have a jury wait. We can bring in, if you have a witness ready, that's fine.
Yeah, we do that.
I did not know that. That's why, that's fine.
Thank you.
Okay, we'll do
That's
that.
why I've been wasting everyone's time.
Oh,
Why he couldn't get his DoorDash order correct?
Gosh. So from here on out, I don't think we're going to have very much boring moments. Krishnamurthy is a
Right,
little
because-
bit.
Yeah, the
exciting.
defense case is about to start, which is going to get much more interesting.
Yeah. So ready for it.
This is so frustrating. So I'm looking at, it looks like to me what Grok is telling me is that this is really a dependency juvenile court thing versus criminal court. And it's not fair. And it's often something that people complain about all the time. But they did this in the Maya Kowalski case too, where they kept out the things that happened in the juvenile court from the criminal proceeding from the civil proceeding that would have shown the jury how much more trauma these parents went through, how much more, heinous acts that the state did to them. Just because they separate those things for whatever reason, juvenile court is given a complete pass for everything they do, even if it's horrible.
Where the bar is set so low for evidence and hearsay, it's already such a joke as it is. And then to claim no, none of that dependency belongs in this criminal. He'll end up saying at some point, he quotes that the welfare of a child is not relevant to his courtroom. It's just crazy to me. If it's by law, if he's allowed to do it, it's so wrong.
Yeah, it's totally wrong, and I can't believe it. We've got one more super tip to go. SF, thanks for the 5. You won't be able to see it on screen, but we should be able to hear it.
Friends from the Netherlands told me that doctors from around the world come to the Netherlands to study and learn medicine. So sure, Guy, the Dutch don't know anything in the medical field. What a tool.
Yeah, there are, my grandma lived in Hawaii for a really long time, and she used to say when she would talk to my parents about moving out there, possibly, she was always trying to get them to go out there, that they would always say things like, we have the best doctors where we are, etc. And she would say this all the time. You would think Jesus Christ himself practices medicine on the mainland. That was what she would say. And she was right. Like people who are on mainland USA, they just think that that's where everything, the greatest of everything is. And the truth is that's not true. That's the best. Some of the best doctors in the world practice in other countries. And the idea that, somehow the Netherlands precludes him from being in. Yeah, it's stupid. It's absolutely stupid. I want to, let's see, I think I missed a super chat too. I missed a couple of them. Let's see. E. Poindexter's member for 10 months says, I just finished a throw I crocheted in time to enter in the fair for the first time ever, thanks to Keto Brains. Wow, that's so cool. I'm so glad. Make sure you stop by tonight at the 8 p.m. show because Molly is going to be on from Keto Brains. She's going to answer all your questions. Sticky, member for 20 months, said, okay, just had a work thing, so I just got here. You can go ahead and restart. Thanks in advance. Greg of Scotland, thanks for the 5. Loving show. Megan, you're a star. Thanks for the square bullet points, by the way. Hello, Fluxx. You're awesome, too. LOL. And hello, Jennifer. Your poor ears when Megan screams. Tell me about it. I know. Something to bark about. Member for 22 months. Hey, y'all. Thanks for the puppy emojis. Those are cute. E. Poindexter, thanks for the 10. I don't want to be yelled at later for not joining your day stream while I'm working because, darn it, I'm here. Could you write a Substack on that? Read my Substack. SF, thanks for the 5. He can't do that, Megan, because he wants this state to win. He will agree with her use of the old law and help the state because a-hole. Yep. And that's what he did. So luckily, the Hernandez family did prevail regardless. Okay, we are finished for today. Thank you for being here. Thank you so much for being here. And please come back again. We will probably not be back here until Monday. And then I'm going to figure out then what a regular schedule is going to look like for summertime. Okay. So probably we're looking at Monday because I'm going to be out of town for a couple of days and I don't know what time I get back on Friday. So I'm not going to be able to figure it out between now and then. So Hernandez trial back on Monday. Tonight we're on my channel. Tomorrow night I'll be on Tug's channel, 8 p.m. And we will see you guys next week. Thanks for being here, Jen.
Thank you, Megan. Appreciate you.
Mr. Ponton, I believe you have a filter turned on in the video settings. You might want to take
we're
a
trying
look.
to, can you hear me, Judge?
I can hear you. I think it's a filter.
It is, and I don't know how to remove it. I've got my assistant here. She's trying to, but I'm prepared to go forward with it. I'm here live. I'm not a cat.
I can see that.